Okay, thank you. Hello, students. Hello. From where we are streaming down with some lag. Or am I visible to all? Am I audible to all? Can all of you hear me? Can all of you see me? Yes, yes, yes. Okay, okay, great. Okay, so can all of you, yes, Dr. Anu, am I visible to all? Am I audible to all? Can all of you hear me? Can all of you see me? Yes, good evening, excellent all of you, superb, good evening all of you. So I think, yeah, just give me 2 seconds just to adjust. Yes, and Monreal Bridges Darkar, welcome, excellent all of you. Just we are going in full screen mode, and yes, okay, so welcome all of you for this session, and thank you all of you for coming in today. And I hope the audio, video, everything is clear. And yes, thank you. Excellent. Foreign students. Excellent. Okay. So great. So it is going to be a fabulous session. And thank you, Dr. Ashish sir. Thank you, Anil C, for having me over here. OG Guru chat में एक बार float कर देंगे. And thank you very much. We are going to do the rapid revision, all of you, rapid revision for the upcoming FMGE examination as well as NEET PG. Okay, along with your, mainly for the FMG, for all the MCQs, all the must know high yield, as I like to call it, as MVP. Yeah, good evening all of you. So as I like, we are going to discuss the most important MCQs, then the virgin MCQ. Those students who know me already will know what is the virgin MCQ. That means the questions not asked till now but will come in the future for sure, is coined by me as virgin MCQ, and the previous year questions also. Okay, so I hope all of you will have a great time today. Don't go home with any doubts, feel free to ask, and we are going to discuss all the most important sessions. Okay, so let us begin the discussion. Let us begin the discussion. Is this understood to all of you? And when I put the question forward, all of you should try to give the answer. All of you sub answers denge. Right, wrong does not matter. We are here to learn from our mistakes. So right, wrong does not matter. All of you, please give the answers. Okay. But before that, before we begin, all of you, just an important thing. So those who haven't already followed me, please start following me on the Instagram. You can click a photo of this, as well as please subscribe to my YouTube channel. Yesterday we have posted a 3-hour video. Many of you are live. Yesterday we had a 3-hour video on this channel for the rapid revision. This has crossed more than 4K views in the last in less than 24 hours. So here all the theoretical concepts, okay, here all the theoretical concepts are covered. So I want all of you to, after finishing this live stream, go and do check out this video, which is the last minute rapid revision. And also yes, and yes, okay, okay, and also the telegram, please do follow me so that you can ask me doubts. Yes, labor questions also will be doing it. Dr. Nikhil will be doing transfer and everything also. Okay, don't worry. Yes, okay. And the increased sound, I think sound is all okay. Sound is okay from my side, I think, beta. Yeah. Okay, let me just see. Increase volume. Okay, just a second. If you tell me if okay. Just a minute. So I'll just see the sound. And yeah, so all I'm not able to array. Yes, okay. So I'll just see whether all clear. Yeah, medical. Okay, thank you very much. And Yes. Okay. So let me know. I will just remove this. Yes. And I think now the sound should be better. Abhi sound better. Let me know. Yes. Okay. So all of you welcome. Let us begin. All of you should participate and do not forget to follow me on the Instagram as well as see the YouTube and the Telegram also. 3 hour video आप कल check करेंगे. Yesterday all theoretical concepts cover किए थे. आज सब MCQ शुरू होगा. And last thing, all of you can download the OG Guru app, and under one day, okay, in less than one day, there is something called as a rapid revision of MCQs, which we are doing at a very, very low cost. I'll again show this later on also, so that all of you can install the app, and it is going to be like entire 2 days. Okay, so like 16 to 18 hours of fabulous MCQ discussion, which all of you can go through. Okay, I'll tell you more about this later on. Let us begin today's session. Yes, now the first and the very basic MCQ: infertility is defined as inability to conceive after. Okay, so this is a PYQ where questions have come on this topic. And yes, so mistake क्या होता है, mistake क्या होता है, directly yes, anybody, how many for option number A after 1 year of marriage? How many want to go for option number A? How many for option number A? Yes, excellent, excellent. All of you. So yes, so please pay attention. This in the heat of the exam. सबको पता है, लेकिन in the heat of the exam, we mark 1 year of marriage. No, this is not there. Infertility is defined as not able to conceive after 1 year. Yes, but regular unprotected intercourse. Why this is important? Because all of you, because if husband is using condoms, wife is using birth control pill, and that is not considered as infertility. Is it understood? So it should be regular unprotected intercourse. Excellent, all of you. Very basic से शुरू करेंगे, advance जाएंगे. Don't worry. Okay, so yes, male factor, female factor, because if husband wife are staying separately, or husband is in India, wife is in America, उसको infertility नहीं बोल सकते हैं. Yes, now again very very important MCQ, clinical case scenario. I have got a 25-year-old lady coming to the OPD brought by mother-in-law. Generally सासी लेके आती है बहू को. Okay, mother-in-law. They are cohabitating since 6 months. Cohabit मतलब living together or sexual activities in 6 months, married since 6 months. What is the next step? Chalo, anybody? Yes, anybody? What will you do? What will you do? Yes, excellent. Okay, Dr. Annam is saying B, do the semen analysis. Somebody is saying do the HSG. Okay, no, no, no. Clap if you have learned something new. Please understand that they are staying together only since 6 months. So I jokingly tell all my students, ओके एंड इवन माई पेशेंट, कि वो खाली एकता कपूर के सीरियल में होता है कि हीरो हीरोइन मीट एंड हीरोइन इज प्रेग्नेंट इन द फर्स्ट शॉट इटसेल्फ. ओके, सो दैट ओनली हैपेंस ओनली इन द क्लैप इफ यू फील हैप्पी. ओके, कि वो खाली एकता कपूर सीरियल और हिंदी पिक्चर में होता है कि हीरो हीरोइन मिला एंड प्रेगनेंसी इन द फर्स्ट शॉट इटसेल्फ. The nature is that infertility, we have to wait for 1 year before we start the investigations, as just now I have told you. Yes, very good. The reason being that if in the first 6 months the patient has not conceived, no problem, the patient can conceive in the remaining time. So here we are not jumping into the investigation. Why? Because if you increase the stress level, stress is success or goes down. Stress is enemy for fertility and success. So you have to be like how in your exam also be stress free, be relaxed. Same thing yahi pe hoga. Here also you need to be just give reassurance, but I'll tell you something more. No need to do investigation. Just tell the patient abhi khali 6 महीना हुआ है, go back home, enjoy, relax. If after another 6 more months also your wife is not conceiving, then you come back to me and then we will investigate you. So just relax, meditate, yoga se hoga, thoko tali. Okay, yoga se hoga. But can anybody tell me what one more thing I can start for the lady? One tablet I can start for the female, so that if she conceives there is no problem. Anybody? Yes, anybody, what are we going to start for the patient so that there is safe pregnancy? Anybody in the chat box? Yes. No, but answer yes. Excellent. Not placebo, but yes. Absolutely correct. Folic acid supplementation. All of you superb. Love all of you. Thokotali clap for all of you. Iron not required. Okay, Nandini. And those that iron is not required. So yes, you can check the hemoglobin. If hemoglobin is low, then you can start iron. Otherwise, by and large, we can just go for folic acid supplementation so that there is going to be prevention of neural tube defect. All of us know because we don't know when she will conceive. So anybody planning pregnancy, folic acid supplementation definitely we can start. Moving on. Is it clear to all of you? Excellent, all of you. Yes, very important. The commonest cause for primary amenorrhea is commonest cause for primary amenorrhea. We will also go on to the definition of primary amenorrhea in some time. And the yes, so beta Dr. Anonymous, the 400 microgram folic acid. Okay, for everybody, 400 microgram folic acid periconceptional, unless there's a history. Okay, is it clear to all of you? Yes. So the commonest cause for primary amenorrhea is, okay. Yes, anybody. So please clap if you feel happy. Again, with every MCQ, I will teach you 2 to 3 MCQs. Okay, and I hope, just to tell you one more point, we had a similar session in the month of December. जैन एफएमजी के पहले दिसंबर में भी मैंने एनएलसी चैनल पे एक बहुत अच्छा ऐसा 3 to 4 hours का रैपिड रिवीजन एमसीक्यू किया था एंड सो मेनी स्टूडेंट्स थैंक मी टिल नाउ. अब तक आई गेट फोन कॉल्स फ्रॉम स्टूडेंट इट्स फ्रॉम दैट 3 to 4 hour सेशन. So many questions actually came in my January FMG, and I can assure you from this yesterday 3 hour session and today 3 hour session. Yesterday was on my YouTube channel, today is on this channel. We are going to get many questions in the July FMG is my guarantee, and you will thank me. Yes, so point number 1, Turner syndrome. Okay, Turner syndrome is the most common cause, and Turner's ka dusra name is ovarian dysgenesis. Is this understood to all of you? Very good, all who said second option. Okay, RMKH or Mullerian agenesis. More questions. RMKH or Mullerian agenesis. Beta NEET PG also, beta Dr. Ruby, absolutely. When I teach, okay, this is the second most common cause. So beta, please understand, today FMG, NEET PG almost same level. 10 years back ऐसे होता था कि NEET PG level थोड़ा difficult, FMG level थोड़ा easy. No, today FMG exams are becoming as difficult. So whatever we teach is all going to be helpful. For the upcoming NEET PG as well as FMG. Beta OP Chaudhary, I'll just tell you, मेरा YouTube channel पे, okay, just go and see, okay, on the YouTube channel, I'll tell you, okay, OP Chaudhary, just follow the YouTube channel, I'll just tell you, you can go there and see, okay, 3 hours video, okay. So RMKH, second most common cause, and androgen insensitivity, third most common cause. Clap, okay. With 1 MCQ, I have discussed 3 MCQs, okay. First most common cause, ovarian dysgenesis, and this. Now, okay, all of you please pay attention. Which of the following I will classify as a patient of primary amenorrhea? Okay, yes, anybody? Thank you, Anonymous XOXO, thank you. Yes, okay, so we know the 3 most common cause. Now chalo. Thank you, Shafiq, thank you for your love and appreciation. Thank you. Yes, okay, so now please all of you pay attention. That patient has not yet attained menarche. Which of the following I would like to label as primary amenorrhea? Okay, yes, so now very quickly dhyan se sunenge all of you that primary amenorrhea definition has changed. Okay, so the old definition was 14 years and 16 years. Please understand, mark it, this is old. But मैं old आपको 1 minute सिखाऊंगा so that you understand what is the new definition. Okay, so in the old definition, we were considering 14 years and 16 years. Okay, sir, if I see a girl in the OPD, all of us know the sequence: thelarchy, pubarchy, menarche. Okay, thelarchy, pubarchy, menarche, breast development, axillary pubic hair, and then the menses start. So this in short is called as secondary sexual characters, SSC. याद रखेंगे. So if I see a girl in the OPD and secondary sexual characters are absent, and she has reached 14 years, that is primary amenorrhea. If secondary sexual characters are present, we would wait till the age of 16 years, and still if the menses don't start, then you label her as primary amenorrhea. Now clap if you feel happy, if you have learned something new, that sir, now this has changed and we have decreased this by one year. This has become 15 and this has become 13. Is this understood? So 13 years and 15 years पे focus करना है. Now when I come back to the MCQ, 14-year-old don't see. Okay, 14-year-old, no menses with breast development. No, okay, because breast development has already started. Here I would like to wait. Is this understood to all of you? I can wait till 15 years. 13-year-old, no menses but with still breast development. Again, I would like to wait. And all of you, those who said option number C, yes, 13-year-old, no menses without breast development, perfectly correct. Option number C is the answer. Is this understood to all of you? Thoko tali. And 14-year-old, no menses without breast, yes, those who said Amritpal Singh, this is the old definition. तो ये MCQ 100% आने वाला है. This is the old. Is it clear, beta? Amritpal Singh, clear? That's the old definition. Okay, so don't make a mistake in this. Sir, 16 and 14 are the old criteria. Please follow the new or the latest criteria where we look at 15 years and where we look at 15 years and 13 years. Okay, moving on. This is absolutely clear, and we know the top 3 causes. Now, anybody, can you tell me which is this diagnosis? What is this diagnosis? Okay, sir, when I see a girl in the OPD, breast is well developed, but there is well developed axillary and pubic hair. Most likely finding is. Now, can anybody tell me which condition? Is a tricky MCQ, tough MCQ है, virgin MCQ है, but will come in the future. Now, can anybody tell me out of the 3 causes of primary amenorrhea जो मैंने आपको बताया है, very quickly, I told you 3 causes for primary amenorrhea: Turner's syndrome, RMKH or Rokitansky-Meyer, and androgen insensitivity. Can anybody tell me who has absent uterus? Who has absent uterus? Absent uterus किस में होता है? Yeah, we are coming to the karyotyping in some time, beta. Harshvardhan, okay? Sorry, Harishvardhan. Yes. So can anybody tell me, sir, streak ovaries? Sir, streak ovaries तो होता है feature of Turner syndrome. Streak ovaries. And when ovaries are streaked, Turners don't have well-developed breast. Please look at the MCQ. Here there is well-developed breast. Okay, is this understood to all of you? Again, you don't get streak ovaries. Okay, is this clear to all of you? Yes, very good. Sir, this is your, that sir, in Turner syndrome. Turner syndrome, uterus होता है, uterus is present, but uterus चिंटू या छोटा uterus होता है. Why? Because sir, Turner syndrome में ovary is not functioning, isn't it? Streak ovaries, and since the ovary is not functioning, uterus is hypoplastic. Is this understood to all of you? Hypoplastic या rudimentary या underdeveloped uterus, and both this, please keep this in mind. Here also the uterus is absent. Here also the uterus is absent. Both these cases uterus is absent. Very good. Okay, here both these cases the uterus is absent, but here the gonad present is ovary. Here the gonad present is testes in the inguinal region. Is this understood? Yes. Okay. So Turner syndrome mein uterus is hypoplastic, and therefore, my dear student, this option B, streak ovary, hypoplastic uterus, is Turner's. That's not the question over here. Yes, sir, this is very likely to be RMKH. Why RMKH? Because, sir, well developed axillary and pubic hair. Okay, axillary and pubic hair is androgen dependent, and therefore we are going to get absent uterus, normal ovary. All those who said option number A is absolutely correct. Okay, so Jinjin, yes, I think I'll go back up. Pradeep, Sayan, Anjana, Medicophil, all that those who said. Okay, okay, sir, here it is absent uterus but normal ovary, and normal ovary will secrete testosterone, and testosterone say you will have well developed pubic hair. Is this clear to all of you? Now just see one word change. Now chalo, tell me the answer. Okay, again similar MCQ. Primary amenorrhea, well developed breast, absence. I'm marking a star. Yes, anybody? Is it the same question? Sir, same question दिया है? No. This is how I like to give confusing MCQs. Okay, so ध्यान से, if you pay attention throughout this next 3 hours, you are going to get lot of knowledge. So please don't miss out. Yes. Okay, sir. Now this is absent uterus, normal ovary is seen in RMKH. All of you very good. You don't get streak ovaries के साथ absent uterus. This is Turner's, and yes, sir, absent uterus, undescended testis. Clap for all of you. Thoko tali. Okay, all of you correct. And what is the diagnosis over here? So this is your complete androgen insensitivity syndrome, also called as testicular feminization syndrome. Is this understood to all of you? So when we have a primary amenorrhea, well developed breast, but absence of axillary and pubic hair, that is this. Okay, so I quickly tell you that please understand, in your entire gynecology, if you will get primary amenorrhea plus absent uterus, think of only two conditions, that is RMKH and androgen insensitivity syndrome. And all of you will focus on the breast development, will be tick 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 tick, but all of you will look at the MCQ for axillary and pubic hair, and here tick tick tick, क्रॉस क्रॉस क्रॉस, क्लैप इफ यू आर हैप्पी. ओके, सो इसके साथ आपका शॉर्ट 2-3 MCQ, बिकॉज ये टॉपिक हर साल आता है, एंड दैट इज द थिंग. ओके, कि सर हियर द फर्स्ट MCQ, well developed axillary pubic hair, that is RMKH normal ovary. Again a popular MCQ. Okay, RMKH, what is normal ovaries? Okay, and here your axillary pubic hair absent, that is the second MCQ, absence of axillary pubic hair. Okay, clap if you have learned something new. Okay, so this is now very simple. Chalo, in a patient of MRKH, which of the following is normal? PYQ. अभी तो आना चाहिए सबको. Everybody should get correct 100%. Yes. Okay, sir. RMKH, another name is Mullerian agenesis. And very quickly, your embryology, एक line में, what all structures in female does the Mullerian duct give rise to? Go from above down. Mullerian duct in female will give rise to fallopian tube, uterus, cervix, and the upper part of the vagina. तो ये सब कुछ जो है is going to be absent, 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 absent. One of the most important statements of my whole lecture, sir, ovary is not a Mullerian derivative. So in a patient of RMKH, ovary is going to be perfectly normal, both structurally and functionally. Okay, lower part of the vagina is okay. Okay, so upper vagina. Okay, so therefore uterus absent, fallopian tube absent, ovary is the answer. I'm sure all of you, very basic, don't make a mistake in this MCQ. Moving on. Yes, again, now match the column. New style of asking question, ये आने वाला है ये साल. Okay, anybody, very simple, don't make a mistake. So एक साथ मैंने I've taken primary amenorrhea 4-5 MCQ so that you become master in the short topic. Yes, anybody? Yes, it was in the previous question. Yes, yes. Yes. Okay, so let us see. Let us see. A B total confusion हो रहा है. Okay. So Turner syndrome is 45XO. No confusion. So 1A, 1A. A और B में से देखना है. 1C out, 1E out. Okay. Now, anybody, RMKH is 46XX. So 2 is C, 2 is C, and now रास खुल चुका है. AIS is XY, 3 is B, 3 is B, and Klinefelter is 47XXY4D. Very good. So all those, please don't make a mistake. This is extremely important. All of you should get this correct. Okay. All of you should get this correct. Okay. Okay. All of you should get this correct. So you don't make a mistake in this. Okay, yes. So this is the answer, 1A, 2C, 3B, 4D. Don't make a mistake in this. Okay, yes, very good. Okay, now moving on to the next MCQ. Again, ये exam में आ चुका है. Simple MCQ. Just identify the modality. This was also asked. Okay, what is this X-ray showing? Image-based question. Yes, so this is a very, very simple thing. All of us know this is a contrast X-ray with the HSG. This is a contrast X-ray with the HSG, hysterosalpingography. Okay, yes. Now please pay attention. Just a second, just see the sound. Okay, yes. Yes, so this. Yes. So now please pay attention. HSG. Now in the chat box, pehle it is the initial investigation for tubal patency. Which day of the cycle? Which day of the cycle HSG is done? Anybody? And what is the instrument used? Can anybody tell me what is this instrument? ये जो instrument आपको दिख रहा है, identify the instrument. So all those who have heard me before, all of you know that with each MCQ, I discuss 2 to 3 MCQs. So more than 500 MCQs are going to be discussed in the next 3 hours time is my guarantee. Yes, anybody in the chat box, which day of the cycle do I do the HSG? Okay, if I tell you No, beta, not 2 to 3 day. Okay, Sri Lakshmi, day 2 to day 3, I do the FSH. No, Sushant, beta, 14 day, very close to ovulation. Yes, no, Sandesh, no. Okay, very good. HSG, just for your knowledge, please pay attention that HSG, अगर 30 day का first 3 4 days the patient is bleeding, so you don't do it, and उसके बाद any time you do, so somewhere around day 8 to day 9, very good, although you said day 8 day 9 up to 10, so day 7 to day 10 is also accepted as the answer. Yes, day 8 day 9 traditionally are looking 7 to 10, very close to ovulation you don't do. And can anybody tell me why? Yes, after the menses are over, completely over. Yes, can anybody tell me why never do HSG on day 23, day 25? Day 23, day 25, I never to do HSG. Okay, and yes, this is the cannula, this is the Leach Wilkinson cannula. Okay, this is the Leach Wilkinson cannula. Okay, yes, very good. किसने कहा? Yes, budding doctor. And no, estrogen बेटा वो नहीं है कि yes, कि sir, there can be a pregnancy. Okay, so uh, Leach Wilkinson cannula is the thing, and perfectly correct. I never do here on day 23, 25 because there could be a pregnancy. We will disturb the pregnancy. Possible chance of pregnancy is there, so never do it post ovulation. And this is nothing much to discuss. Of course, और आगे picture आएगा. This is the answer, hysterosalpingography and Leach Wilkinson cannula, just to show you that in this picture only I can see the uterus which is there. This side tube is not seen, and here also not a well formed picture, but I've taken the actual image which had come in the exam. So just very quickly to tell all of you that how will the HSG look like. So this is the normal uterus which you would see, then you see the bouncy wavy tube, and then we see the spill of the dye. Okay, what does the spill of the dye indicate? Anybody? Many students thought that spill is abnormal. No, spill होना चाहिए. Anybody? Spill should be there or spill should not be there. This is the spill of the dye. So that tells me that the tubes are patent. Tubes are patent. Okay. Is this clear to all of you? Okay, yes, okay, yes. So now anybody, yes, moving on. What is BPP and what is modified BPP? Okay, so this is very good. Okay, this is now moving on. So exam में भी जैसे mix आएगा, obs gynae अभी option इसके थोड़े question आएंगे, obs gynae mix आएगा. Okay, yes, anybody? So can anybody tell me BPP first is called as whose criteria? BPP is whose criteria? What is the name? किसका नाम है बीपीपी के साथ जुड़ा हुआ? Yes, sir. BPP is your Manning's criteria or Manning's score. Okay. So BPP is called as the Manning's score. Okay, and totally for BPP there are 5 criterias. 5 we should know. Very good, very good. 5 criterias. Anybody, what is the maximum score of BPP? So, sir, each component, totally there are 5 criterias. 1, 2, 3, 4, 5. Totally there are 5 criterias. Each is given a score of 2 or 0. And therefore, the maximum score of BPP possible is 10. 10 by 10 matlab baby is takatak. Baby is perfectly fine. Okay, not to worry. बेटा डिलेड स्पिल कुछ नहीं है, नोनो दुहान. ओके, डिलेड स्पिल में जस्ट बी व्हेन यू आर पुशिंग द डाई, अगर आपका डाई इज नॉट गोइंग प्रॉपरली द स्पिल में बी डिलेड, दैट इज ओके. फ्री स्पिल मतलब अच्छे से एकदम फ्री स्पिल हो गया. लॉक्यूलेटेड स्पिल, वेरी गुड ऑल ऑफ इट. एंड लॉक्यूलेटेड स्पिल में इंडिकेट सम एडिशंस. सो जैसे ये जो मैंने कहा, दिस कॉल्ड लाइक अ फ्री स्पिल. फ्री स्पिल मतलब सब जगह गया है, दैट्स कॉल्ड अ फ्री स्पिल. Okay, if the dye is only, if the tube is coming like this, and suppose the dye is going only here and there is only a spill over here, that there could be some, that's called a loculated, matlab only on one side. Okay, only in some area, so loculate, there might be indicating some adhesions. Okay, so don't bother about that. Okay, yes, now perfectly correct all of you. 10 on 10 is the best score. What are the components? NST, I'm telling you all the 5 components. Look, can anybody tell me what are the 5 components? NST देखते हैं, fetal tone देखते हैं, fetal movements देखते हैं, fetal breathing movements, and lastly, there should at least be one pocket, okay, amniotic fluid का volume, amniotic fluid volume or pocket, single pocket in one. There should at least be a pocket of 2 by 2 centimeter. Okay, one at least in one of the quadrant there should be a pocket of 2 by 2 centimeter. So forget that amniotic fluid volume. तो इसमें से because it is time consuming, very good all of you, टोन नहीं होता है. Yes, AFI. What is AFI? Amniotic fluid index. And NST is the modified BPP. So modified BPP, remember there are only 2 criteria. Okay, total BPP 5 criteria, modified BPP only 2, NST and AFI. Excellent all of you. Okay, NST filter movement. Yes. Now the trick question. Now the trick question which was asked in the last year's 1 year back in the INI CET. ये जो fetal movements है, ये जो fetal movements है, who will count the fetal movements? Okay, in BPP, चलो MCQ, who will count the fetal movements? All of you, mother, father, neighbor, intern, none of the above. Who will count the movements? Who will? A, B, C, D, E. ठीक है, जैसे भी A, B. Okay, who will count the movements? Who will count the movements? Fetal movements in BPP is the question. Mother. Okay, who is saying neighbor? Mother. read, excellent. Okay, mother. Okay, neighbor. Why should the neighbor count? कुछ तो गड़बड़ है दया. Why is neighbor counting? नेबर क्यों काउंट कर रहा है मूवमेंट्स? एंड इंटर्न, नो बेटा, इंटर्न को काम नहीं है. इंटर्न को प्रदीप एंड मेडिकोफिल, इंटर्न को बहुत सारा काम है. इंटर्न हैज टू स्टडी फॉर FMG, नीट PG. इंटर्न शुड नॉट वेस्ट टाइम. ओके, यस. सो दिस इज अ डांडी क्लिक trick MCQ, and mother is not the answer. Okay, in BPP, please understand. Okay. In BPP, mother is not going to count the fetal movements. Is this clear to all of you? Mother which counts the movements, mother जो खुद का movement, that is called fetal kick count. I just want to tell all of you this take home message, and clap if you have learned something new. A fetal kick count is separate from fetal movements. Yes, none of the above. Very good, Sanjay, because radiologist is the answer. Radiologist or the sonologist will count the fetal movement when we are doing BPP. Is this understood to all of you? So all these components, after doing the NST, the fetal tone, the fetal movement, the fetal breathing movement, and amniotic fluid pocket, all this is counted by sonography, and a sonologist is required. Clap if you have learned something new. Is this clear to all of you? Okay, so just खाली याद रखना कि ये this and this was the question in FMG. Okay, sir, this is fetal movements. Note down, and not FKC. Is this clear to all of you? Okay, sir, in BPP it is not fetal kick count. Fetal kick count mother does. Okay, yes, it is not FKC. Okay, it is not FKC, it is fetal movements which a sonologist will count. So this is just by the way कि sir mother father neighbor intern नहीं है, radiologist or sonologist. Very good. चलो, one of the most important MCQ surely coming in the exam. All of the following are the screening tests used in the second trimester for aneuploidy or trisomy 21 except anybody? All of the following are the AB. Okay, so now please understand very quickly, very quickly, what are the three tests what we should know, and you will get lot of knowledge. Please pay attention, all of you. You will get lot of knowledge that anybody. Chalo, when is the triple marker test performed? Okay, when is the triple marker test performed, and what are the three markers we do in triple marker test? So triple marker test, HCG, alpha fetoprotein, unconjugated estriol, ESTRIOL. And yes, sir, this is done in the second trimester. When? Anybody, when do I do triple marker test? Which time? What is the weeks of gestation? कल बताया, आज रिवीजन. कल का वीडियो को प्लीज जाके देखना. वेरी गुड ऑल ऑफ यू. अमल, मेडिकोफिल, दिस इज डन एट 16 to 18 weeks. And what is the interpretation if in case the baby is having Down syndrome? HCG arrow up, other two arrow down. Very good all of you. Triple marker test is done in the second trimester, 16 to 18 weeks, and quadruple marker test is also done in the second trimester, 16 to 18 weeks only. Okay, please understand, this is 3. It is estriol, ESTRIOL. Quadruple में क्या add करते हैं all of you? Inhibin A, and inhibin A is higher than normal. Okay, so you can see that sir, inhibin, alpha fetoprotein, estriol, HCG. Yes, HCG is a overlap. HCG is a overlap. So alpha fetoprotein, inhibin. So clearly we are doing it in the second trimester. Except is the question. The question is except. Yes. PAP A. Anybody? Why? Because dual marker test is done in the dual marker test is done in the first trimester. Dual marker test is done in the first trimester, and where we use HCG. Yes, so HCG is, you may think that sir, HCG is in the first trimester, but it is also in the second trimester, and therefore HCG is not the answer, and PAP A is the better answer to mark. Is this understood to all of you? Because sir, HCG and PAP A. Pregnancy associated plasma protein A, HCG, and PAP A is what? Pregnancy associated plasma protein A. HCG is higher than normal, but PAP A is lesser than normal if the baby is having trisomy 21. Please understand, it's a doubt. It's not 100% confirmatory. It is a screening test. Okay. So now, can anybody tell me? What do I do if the screening test is positive? Is this understood to all of you? Suppose if I tell you, chalo, tell me the MCQ. 11 weeks pregnant lady, 11 weeks pregnant lady has come to the OPD and the dual marker test is high risk. Dual marker test, high risk for trisomy 21. What next? Question समझ में आ गया? Virgin MCQ for the upcoming exam. Wait and watch. Wait and watch, of course, because it is a trisomy 21 MTP. And sir, क्योंकि dual marker test किया है, let me do a quadruple marker test. Anybody, what will I do? चलो 4 options है. Excellent, all of you, excellent. The take home message is you never wait and watch. You never directly do MTP because this is only a risk. Dual marker test is not a confirmatory test. I need to do a confirmatory test, which is by doing the fetal karyotyping is the answer, all of you. And yes, uh, thank you, Rajiv. Thank you very much for the love and appreciation. Yes. So, karyotyping is the answer over here. And remember, yes, now we have got two options. Okay, sir, we are 11 weeks, so I can do chorionic villus sampling. Okay, that is the most logical step because amnio is done between, amnio is also not wrong. Karyotyping can be done with amniocentesis between 16 to 18 weeks. Agar hai, at 16 to 18 weeks, I can do amniocentesis. So also please don't forget at what weeks of gestation the patient comes to you. Okay, is this clear to all of you? Okay, is it clear to all of you? Yes. So now moving on to the next. Okay, so is this clear? ये वाला हो गया है, ये वाला. So the PAP A is the answer, sir. PAP A is done in the first trimester. And any screening test, if it is abnormal, if screening test is abnormal, please go for the confirmatory testing. Please go for the confirmatory testing. Is this understood to all of you? Yes. Can anybody identify the image? One more image based MCQ. Yes, very good. Sanjay's karyotyping first, karyotyping by CVS in the first trimester and amniocentesis in the second trimester. Yes. Yes, confirm. Yes. चलो, what is this image? ये क्या image है? In the chat box, what is this image showing you? Okay. Anybody? Answer के पहले. So this is it a copper T? Is it a copper T? So it is a complete white color device. It is complete white and therefore it is a LNG intrauterine device. It is a very good, all of you, LNG intrauterine device, also called as Myrina. Okay, क्या content है? All that picture अभी बाकी है. There are questions on this also. Excellent, all of you. Yes, excellent, all of you. So it is the LNG intrauterine device, also called as Myrina. Now what does it release? Sir, it is going to release continuous progesterone. So if it is going to release continuous progesterone, progesterone is for prevention and treatment of endometrial hyperplasia, and therefore yes, I can use it for treatment. Okay, all are the benefits except pucha hai question, except. Okay, what happens to the menses? Anybody? What happens to the menses when I put the LNG IUD? Okay, जब LNG IUD डालते हैं यूट्रस के अंदर, what happens to the periods? Okay, so please pay attention. Continuous progesterone is released, and progesterone, my dear student, is going to counteract the estrogen. Progesterone is going to counteract the estrogen, and therefore progesterone will not allow the lining to grow. Okay, no, irregular zyada beta kya ho jayega? Can you tell me whether the periods will be heavy or scanty or light or absent? Okay, so normally, now please pay attention. Normally, sir, what is menses, sir? If the lining grows, if the lining of the uterus grows, then the lining will shed off. That is the menses, isn't it? But because of continuous progesterone, we are giving continuous progesterone, क्या हो जाता है? Sir, it goes, the body goes into the state of progesterone induced amenorrhea. I tell all my students, clap if you feel happy. ठोको ताली. कि sir, only if the beard is growing, I will shave. अगर बियर्ड ग्रो ही नहीं हो रहा है, टाइगर श्रॉफ, तो क्या शेव करेंगे? ओके, सो बेसिकली यस भारती, स्कैंटी यस, कि सर द लाइनिंग इज गोइंग टू रिमेन very thin, and therefore there is like no periods. Okay, there is no periods or hardly any flow, and therefore one of the most important, yes, Dr. Ru, it is used in menorrhagia and heavy menstrual bleeding. Okay, so basically there is going to be no periods, and progesterone induced amenorrhea status is reached, and therefore I will use it in dysmenorrhea as well as HMB, heavy menstrual bleeding. Okay, so heavy menstrual bleeding because menses will become scanty or even stop, and yes, the cervical mucus will become thick. So when the cervical mucus becomes thick, PID episodes become less, and therefore again ectopic is also prevented. So none of the above is the answer. Basically all the three are the benefits. So remember, menorrhagia, dysmenorrhea, heavy menstrual bleeding, all these cases we can use. Is it understood? Clap if you have learned something new. So continuous progesterone, and this protects against ectopic because remember, cervical mucus will become thick. So the cervical mucus will become thick. The PID episodes, pelvic inflammatory disease episodes, are going to become less PID. Okay. The contraindications would only be like a distorted cavity, if the cavity is distorted, or if there is acute any infection, then in that cases we can't insert the Mirena, or if it's actually already proven cancer, then I don't put, or any progesterone dependent cancer in the body, that I don't. Otherwise we can do Mirena insertion for everybody. The distorted cavity, acute PID would be the contraindication specifically for this Mirena. Okay, is it clear to all of you? So don't make a mistake. आगे और questions आने वाला है. Earliest diagnosis of live pregnancy is by anybody? A, B, C, D. Yes. Anybody? What is the main thing? Yes. So anybody for live pregnancy, D be wrong, B be wrong. Okay. No. Okay. Please, all of you are making wrong. Amal, Diwan, Medico feel no, but no problem. Anybody live pregnancy अगर वर्ड नहीं है, नो ऑल ऑफ यू ट्रिक MCQ. अगर earliest diagnosis of pregnancy is the question, then serum beta HCG is the earliest diagnosis of pregnancy. How early? Sir, even before missed periods. Okay, even before missed periods is the beta HCG becoming positive. Yes, Amritpal. Okay, sir, I want for live pregnancy जिंदा हूं मैं. बच्चा क्या, बेबी क्या बोले, शाहरुख खान क्या बोले पठान में, जिंदा है. ओके, सो लाइव के लिए on the sonography, fetal cardiac activity has to be seen. So this is two MCQs. Clap if you feel happy. एक के साथ दो. Okay. And therefore transvaginal sonography can pick up the baby heartbeat 5 weeks 5 days. बहुत early हो गया, to roughly around 6 weeks. Okay. Roughly 5 weeks 5 days to 6 weeks के बीच में. Okay. we will be able to get the transvaginal sonography. Transabdominal is after 1 week. Okay, so please understand that serum beta hcg, clap if you have learned something new, is the earliest to diagnose pregnancy. It is definitely diagnosis of pregnancy, but for live pregnancy, beta upt also, beta uc UPT, if it is Dr. Anonymous, after the serum beta hcg, the urine test will be positive. Now common sense, if somebody's UPT is positive, okay, अगर किसी patient का UPT is positive, just by looking at the urine kit, okay, 2 lines आ गया, can I say baby is alive or baby is dead? No. Is it clear? So serum beta hcg becomes positive first, and then urine pregnancy test becomes positive. Okay, Anonymous. But UPT is for diagnosis of pregnancy. Okay. For live pregnancy, I have to see the fetal cardiac activity. Is this understood to all of you? Can I get 10 thumbs up? Then only I'll proceed further. Okay, Anonymous, exo समझ में आ गया बेटा? A fetal cardiac activity can be demonstrated by transvaginal sonography and then by transabdominal, and that will only tell me if the baby is live or not. If they tell you earliest to diagnose pregnancy, serum beta hcg, next then UPT is positive after serum. Okay, yes. Moving on to the next important MCQ. Yes. Okay. Yes. Okay. 16 weeks pregnant lady with a past history of Down syndrome, best evaluated by. Okay, so here again the concept is that when thank you Roy, the old excellent. Okay, yes. Okay, no Bharti, I'm just a teacher who loves teaching and who loves interacting with the students. Yes. Okay, now here what is the concept? Okay, yes. Okay, sir, when there is a past history of a patient who says कि डॉक्टर my पहले बेबी को डाउन सिंड्रोम है, please don't waste time in doing triple marker test or quadruple marker test, because it is not confirmatory. These are not confirmatory. Is this clear to all of you? Yes, again, color Doppler has got no role over here. I have to take the concept कि sir there is a past history of a baby with Down syndrome. So patient बोलता है कि doctor tell me confirm. Doctor please tell me confirm. I need to tell confirm. Why? Because sir, suppose the triple marker test is abnormal. Will I do MTP? No, I cannot directly do MTP. So हमको confirm, and can I, if the triple marker test is normal, can I tell the patient that you please relax? Everything is okay with the baby? No, it's only a screening test. The confirmatory testing has to be done. Confirm test has to be done, and that all of you told me it is the karyotyping. And look at the weeks. Whoever said chorionic villus sampling thoda wrong ho gaya. We are 16 weeks. Chorionic villus sampling is done only between 11 to 13 weeks of gestation, and therefore the answer is amniocentesis. Clap, thoko tali. Amnio, and of course karyotyping. Okay, amniocentesis and karyotyping is to be done. Is it clear to all of you? Okay, is it clear to all of you? Suppose the same MCQ now with 3 variation. Okay, variation in the MCQ. Now all of you tell me, suppose if I tell you the whole question is ये 16 weeks हटा के मैंने बता दिया 11 weeks. Now tell me the answer. Now tell me the answer. Anybody? If I tell you कि so एक MCQ के साथ एक पे एक free. Yes, all of you correct. All of you correct. Let's suppose if I tell 11 weeks, then the answer is chorionic villus sampling. Okay, is this crystal clear concept hashtag? So please see the weeks of gestation, and since this is 16 weeks, the answer is amniocentesis plus karyotyping, because I need to go for the confirmatory testing this time. Okay, CVS is done in the first trimester. Yes, superb, all of you, excellent. Drop in the fetal heart rate with placental insufficiency is. So we do the baby heart rate in NST and CTG, and if there is placental insufficiency, which kind of deceleration we are going to see. So again, with one MCQ, three types of MCQ. Okay, with this one MCQ, I'm going to discuss three MCQs. Okay, yes. Okay, so the early deceleration is seen with head compression. When the baby's head touches the pelvic floor, head compression, you get early deceleration. And the answer over here is late deceleration, because placental insufficiency, that means uteroplacental insufficiency or fetal distress. Fetal distress word is used, or even fetal hypoxia is used, then the answer is late deceleration. Anybody? Variable deceleration कब होता है? Variable deceleration is with cord compression. Is this understood to all of you? So we are getting the three MCQs, and don't make a mistake. Early deceleration, head compression, late deceleration seen in fetal distress or placental insufficiency, and variable deceleration, the answer, that is seen in cord compression. Cord compression, we get variable deceleration. So please don't make a mistake, and all of you should also know the criteria for reactive NST. Okay, what is the criteria for a reactive NST? How many accelerations? So there should be two or more acceleration in 20 minutes, each being 15 beats above the baseline and lasting for 15 seconds. That means acceleration start हुआ, ऊपर तक गया, खत्म हुआ, that should last for 15 seconds or more. Is this understood to all of you? Yes, all of you, all you got. Okay, yes, so excellent, all of you, perfectly correct, and that is the answer over here, late deceleration. And 15 beats, that means suppose the baseline is 120, this should at least go up to 135. Okay, and lasting for 15 seconds or more, that is the definition. Yes, anybody? Again, a very popular MCQ, short coming. Ideal time to perform the NT is done at what weeks of gestation? Short MCQ. Yes, anonymous. Yes, if it's a fetal distress, and then if it's only 4-5 centimeter, we do LSCS. Suppose she is fully dilated, you can try to apply forceps or vacuum, but you are correct. Most of the time for fetal distress, you have to do LSCS. Yes, yes. So no. Okay, so please understand this. Yes, so answer is 11 to 13 weeks of gestation. So can anybody, just to summarize, which all test we do at 11 to 13 weeks? Can anybody tell me what is the importance of 11 to 13 weeks? Clap if you feel happy. So इस तरह से हम सीखा, because that is what students tell me कि sir, once we listen to your lecture we remember things for long time. तो आज ही मैंने बताया 11 to 13 वीक्स पे सर वी डू ड्यूअल मार्कर टेस्ट का भी सेम टाइम है, एंड the if required chorionic villus sampling also 11 to 13. Okay, all those who are saying 18 to 20 weeks, no, 18 to 20 weeks I don't do the nuchal translucency test. Here which sonography I do the anomaly scan. Okay, the anomaly scan is done, which is the most important scan for the pregnant lady. Yes, and I will also do very good Shalini. Okay, yes, anomaly scan, also called as the TIFA scan, targeted. Okay, anybody, what is TIFA scan? नाम बड़ा है, बाकी कुछ नहीं है. Okay, TIFA scan, targeted imaging for fetal anomaly. Okay, this is fetal anomaly. मतलब basically anomaly scan is to be done between 16 to 18 weeks of, okay, is to be done between this. Okay, and this is nowadays called as also NBNT scan, because we also check for nasal bone. Okay, I also shown, so I was just telling you in yesterday's video I've shown the image also, so please go and see that also. Yeah, I'll try to discuss. Okay, yes, very good. Okay, so NBNT scan is the answer over here. And what should be the NT value? Sir, NT should always be less than 3 millimeter. Okay, up to 3 millimeter is considered normal. NT should always be less than 3 millimeters. Okay, even this is the baby ka nose, this is the baby ka mouth, and this is how the baby looks with like this. So you have to zoom in this part, and we look at the nape of the neck. We look at the nape of the neck. Yes, this is the nasal bone we check. Because why nasal bone we check? Because absent nasal bone. Okay, absent nasal bone, and here we put in the caliper. We put in the caliper here and here, and you measure this space, which is the NT, and NT should be like 1 millimeter, 1.5 millimeter. Is this understood to all of you? Okay, so that is the NBNT scan, because remember student, absent nasal bone. Absent nasal bone is a marker for Down syndrome. Absent nasal bone is a bad sign, and if the increase in NT, both these are bad. Okay, both these are bad. Okay, yes, is this understood to all of you? Now can anybody tell me, before I just proceed, uh, just a second, all of you. Yes, so okay, so very quickly, as I was telling all of you, that please do not forget to follow me on the Instagram. You can scan this QR code and also see the YouTube channel, my YouTube channel, where I have posted yesterday a 3-hour rapid revision, last minute revision. Okay, rapid revision video is there. So all of you, and also do not forget to join on the Telegram. Okay, so please, all of you can go and see after our session is over. This video has already got more than 4K views in the last less than 24 hours. Okay, about that I'll just tell in some time. Okay, yes, so moving on to the, yes, okay, now the patient has come to us, short MCQ. Patient has come to us with a septum in the uterus. Septum in the uterus. तो क्या करेंगे? Beta, Madini, Raza, both beta. This revision for NEET PG as well as for FMG. Okay, Raza, please enjoy the lecture. You're going to get lots of questions. All this is questions have come in both. This is NEET PG MCQ as well as previous year MCQ. Yes. So FMG also. Okay. So both we are there, and the revisions are for all. Yes. So please don't make a mistake. Excellent, all of you. Please understand this, that septate uterus कैसे होता है कि सर इन द सेप्टम, okay, in the septum uterus, the cavity, so this is the uterus, this is the uterus, and this is the septum. Is this understood to all of you? This is how, yes, septum is seen from inside. No point doing laparoscopy. Laparoscopy, where you will do, I'll again teach you, this is a very common mistake. So laparoscopy, we are seeing the outside surface of the uterus, and in the outer surface of the uterus, in case of septum, to normal hai. So in hysteroscopy, we put a, can anybody tell me which other pathology can be tackled with hysteroscopy? Okay, tell me two other conditions where I can do hysteroscopy surgery. Yes, seeing is believing. Okay, so you put in a telescope in the hysteroscopy and see the cavity of the uterus. Yes, excellent, all of you. Okay, sir, anything to do with the cavity of the uterus? Yes, yes, sir. Agar example, there is intrauterine adhesion or Asherman syndrome or a submucosal fibroid, then even the, that also we will tackle with the we will tackle with the hysteroscopy only, and all of you can see, yes sir, I will cut the septum with the hysteroscopy, I will cut the adhesions with the hysteroscopic scissors. Okay, is this understood to all of you? So this is a very very important, or there is any other polyp, there is any other polyp or a fibroid in the cavity, all that. Okay, so the answer is not laparoscopic meteroplasty, not laparoscopic resection. Perfectly correct. We have to go for hysteroscopic septoplasty बोल सकते हैं, या hysteroscopic septal resection बोल सकते हैं. Septal resection. Okay, hysteroscopic septal resection can be done. The outside view you have to do a, yes, if there is a fibroid outside, or the, we'll discuss endometriosis, all that, then you have to go for this. Okay, now anybody, very simple, laparoscopy chromoperturbation, it is what test? Laparoscopy chromoperturbation is for what? Anybody, what kind of a test is this? This is the test for what? Again, a previous year question. Laparoscopy chromoperturbation, again I'll show the picture also today. It is the best investigation for tubal patency. Is this understood to all of you? It is the best investigation for tubal patency. Not beta Amal, PCOS के लिए नहीं है बेटा. Okay, it is laparoscopic chromoperturbation. We will check if the patient tubes are patent or not by putting a methylene blue dye. Very good, methylene blue dye. Yes, laparoscopy can be done for ectopic, but like chromoperturbation specifically is only for tubal patency. Chromo means color. Is it clear, Amal? And pertubation means to put inside the tube. Okay, so basically what, I'll show you the picture in the upcoming picture. I've got a picture also. Yes, it's the gold standard. Okay, yes, it's an invasive test, and we are putting we directly see the color at the fimbrial end, beta. Okay, Roy. Only one mistake. We see the fimbrial end. Okay, so you will see the fimbrial end, say the dye coming out. Okay, like this. Okay, so this is the uterus, and we put the blue color dye through the cervix. Okay, the blue color dye is injected through the cervix. Okay, we put the blue and we do the telescope here. So we are seeing the telescope, we are doing a laparoscopy. Okay, we are doing a laparoscopy, and then the blue color dye I will inject, and the dye will go here, and everybody start jumping in the OT. Blue hai, yes, very good. Okay, yes, correct. Okay, blue hai, okay, and then you see. So this is also called the spill of the dye. Okay, so this is the spill of the dye which you see. So this procedure is called as laparoscopy chromoperturbation, and it's a very confusing MCQ which had come few years back. Okay, sir, if HSG is showing tubal block, HSG is showing a block, please do laparoscopy. Don't directly jump to the treatment, because HSG showing block, I need to confirm with laparoscopy. Okay. Yeah, so ostial end, this is generally called the cornual end or the ostia. Okay, this is called the inside of where it's opening in the cavity is through the fimbrial end. Okay, so through the fimbrial end, we see the blue color dye is coming out or not. Okay, yes. Now, anybody, yes. Okay, so we have done this, yes. Now, again, a difficult clinical case based scenario. Chalo, tell me the diagnosis. Okay, anybody? Tell me the diagnosis. We have got a patient. We have got a patient who has, yeah, okay, yes, 32-year-old patient, 36 weeks pregnant. Okay, comes to the OPD with painless bleeding. So bleeding in the third trimester, very important condition, bleeding in the third trimester, painless, yes, all of you, very good. Okay, sir, and the BP is normal and the uterus is relaxed. Okay, uterus is relaxed. So eclampsia kuch nahi hai. Eclampsia is, they'll tell you convulsion, will show this, and of course none of the one hai. You have to choose between A and B, and very good, this is placenta previa. Why this is placenta previa? Okay, what will the management also will discuss in some time. Okay, so placenta previa may, what is the common thing between in abruption and placenta previa is that there is going to be bleeding in the third trimester, T3. T3 is our short form. Yes, very good. Placenta previa, placenta previa is a painless bleeding, and it's a episodic bleeding. Bleeding start, stop, start, stop. Whereas abruption is always painful. Abruption is pain. Pain is there, and abruption is painful. And one more thing, here the uterus is relaxed. The uterus is relaxed. Yes, third trimester bleeding. Yes, okay. And here, what will be the tone? Sir, uterus increased tone. Yes, we are going, okay. So the increased tone, okay. So uterus could be tender, the increased tone is there. Okay, and can anybody tell me that which condition is predisposed or complication can happen because of hypertension and preeclampsia? If I tell you patient is having preeclampsia or hypertension, which of the two is the likely combination, likely complication? Yes, increased uterine tone, and therefore you can get the word even. See, anywhere in the question paper ना, अगर आपको देखा tonically contracted uterus, tonically contracted uterus, tonically contracted uterus. Yes, sir, here very likely associated. Yes, sir, preeclampsia hypertension is one of the most important risk factor. Okay, it is a risk factor for development of abruption. That's not the case over here. So if in the question paper, please understand this, in the here the BP is also normal. If the same MCQ आता है कि patient's BP is 150 100 and now the bleeding has started, bleeding is plus and of course it's a painful bleeding, then we have to mark it as abruption. Okay, so painful bleeding associated with high blood pressure and increase in the uterine tone are the features. And anybody out of the two, which condition I can wait and watch, which condition I never wait and watch? Anybody? Which condition I wait and watch, which condition I can never wait and watch? This is extremely important point, student. Don't make a mistake in this. Yes. So, sir, placenta. So that is it. Anybody, what is the answer? Expected management in placenta previa. Expected management matlab I will wait and watch. What do we do in this wait and watch? Sir, we will नो बेटा ओके प्लासेंटा प्रीविया यू कैन ओके बेटा भारती थोड़ा कंफ्यूज हो गया ओके नो 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 अमृतपाल नेवर अब्रप्शन नेवर ओके यस अब्रप्शन इज एन इमरजेंसी ओके सो डोंट गेट कंफ्यूज ओके एक्सपेक्टेड चलो टेल मी द आंसर दिस so yes that sir this is McAfee and Johnson regime where you will admit the patient of writing complete CBR complete bed rest you will give. Why will I give steroids? Anybody? Steroids क्यों देंगे? Lung maturity. And yes, I will give tocolysis. I will give tocolysis. Okay. Yes. Okay, sir. Whenever we wait and watch in placenta previa, when the mother is stable and the baby is stable, then I will go for McAfee and Johnson. Abruption once it has started. Please understand this. Why? Because the bleeding will keep on happening. Only when you deliver the placenta will the abruption stop. Otherwise, the baby will die, mother will die. So abruption, never wait and watch. Okay, never wait and watch. Is this understood to all of you? 10 thumbs up, then only I'll proceed further. Okay, Thoko Tali, crystal clear in the chat box. OG in the chat box, all of you. Abruption, never wait and watch because the bleeding will keep on happening, and the mother will die and the baby will die, and the bleeding will only stop once the baby, once the placenta comes out. Okay, so McAfee and Johnson is a condition where I give steroids for the baby. Lung maturity, tocolysis can be given, and complete bed rest. Very good. In abruption, you need to do the delivery as soon as possible. Deliver ASAP. अभी और बाकी है पिक्चर में आपको और ये बताना है. Anybody, what is the Brand Andrews method? Brand Andrews method क्या है? Brand Andrews method. Brand Andrews method. Anybody? Brand Andrews method is when I do control cord traction. It is control cord traction CCT to deliver the placenta. Okay. Brand Andrews method is control cord traction to deliver the placenta. So with one MCQ again I'm telling you, yes, third stage. Okay, yes. Okay, is this understood? Yes. And Creed's method is outdated कचरा डस्टबिन. Creed's method नहीं करते, उसमें हम लोग फंडस को स्क्वीज करते थे. Okay, we are pulling the placenta and squeezing the fundus. That was causing inversion of the uterus. So Creed's method अभी नहीं follow करते हैं. And Lily's method नहीं है, Lily's का chart होता है. There's a Lily's chart for RH isoimmunization. Yes, okay. So Brand Andrews method is a control called. Thank you, Roy the Gamer. Thank you for your love and appreciation. And yes, others also can follow the book, and all of you will do very well in the exam. Yes, AMTSL mein, is my guarantee. Okay, so control cord retraction for delivery of the placenta. Okay. Is this understood to all of you? So abruption, never wait and watch, deliver the patient as soon as possible. And this, okay, yes. Now again, like a rapid revision, histro will not waste much time, indicated in all of the following except. So already discussed kar diya hai, sir. Asherman syndrome, we are going to do hysteroscopy. Your menorrhagia, your polyp and fibroid will cause menorrhagia, fibroid in the cavity, and therefore also, and of course adhesions will cause infertility. Adenomyosis, very good. Adenomyosis के लिए we do ultrasonography or MRI. Why? Because where is adenomyosis? Anybody, what is adenomyosis? Concept पता है, answer पता है. Okay, that's why my students hardly mug up. They say, sir, we listened to you one time, we remember things lifelong. Okay, sir, adenomyosis is the glands, endometrial glands within the myometrium. Just the definition, तो आंसर पता चल गया. Okay, sir, glands within the myometrium. तो सर यहाँ पे ऐसा है कि this is the uterus and these are these glands. ये glands है, glands within the myometrium. So no point, no role of hysteroscopy. Hysteroscopy, no role. Is it clear? Adenomyosis is not outside the myometrium, but just within the myometrium. Yes, glands, adenomyosis are glands within the myometrium. Okay. Adenomyosis होने दो या आंसर, या इवन endometriosis भी. Endometriosis में outside. Okay, endometriosis में outside. Okay, endometriosis में outside. So for both this is outside the uterus. Okay, is it clear to all of you? Yes. Now again a PYQ, very likely to be repeated. Anybody, what is this image? What is this image which I have shown you? Identify the image. Yes. What is this? What is this? And with what do you use it? So this is the cannula which I use for MTP, basically suction evacuation. Basically, it is for manual vacuum aspiration. Yes. This is the Carmen's cannula which we use with the MVA syringe, manual vacuum aspiration with the MVA syringe. Okay, so instead of the metal suction capable, basically it is for the MVA, manual vacuum aspiration. And the rule or the logic is कि जो भी weeks hai, same is the answer. So in 8 weeks, that means you start dilating from the lowest number. Okay, so you dilate, you first go with 4 number, 5 number, 6 number, 7 number, 8 number. Obviously serial dilatation karte hain, and this acts as a dilator also. Okay, so you don't have to use it. Acts as a dilator, plus it acts as a cannula also. Okay, so dilate up to number 8 and suck out the pregnancy. Okay, nothing more to discuss in this. Of course, we'll discuss other things also. Extremely important, sure shot. As per the latest criteria now, the MTP is allowed till dash weeks of gestation. वीक नहीं बेटा, दिखा ना यहाँ पे, अच्छा अच्छा सॉरी, ओके, हाँ हाँ, ओके, लोगों के पीछे, या ओके, यस यस यस, ओके, सो यस, सॉरी दिस, सो द, या आई थिंक या इट हैज गॉन जस्ट बिहाइंड द एनएलसी, यस, नो प्रॉब्लम, यस, सो 8 वीक्स था, 8 वीक्स, ओके, द क्वेश्चन इज 8 वीक्स, ओके, yeah, okay, yeah, the question was 8 weeks, the question is 8 weeks, okay, so it is, the question is 8 weeks, okay, 8 weeks, G3P2M2 for MT. Yes, very good, all of you. Uh, yes, very good. So the answer over here, no. Okay, beta, Sushant and those who are saying B. So 20 was the old criteria, and now it is allowed till 24 weeks of gestation. Anybody for MTP whose consent? MTP is no, beta Jaimik Gadvi. No, beta Gadvi beta nahi. Okay, 20 was the old. Now, but I'll tell you for which condition it is still 20. Yes. So 24 weeks is the answer. For which condition? Yes, sir. Why this 20 was raised to 24? 20 was made for 24 because, no, Nishant, okay? 28, okay? So here in cases of rape victim or certain sexual assault victim, or if the fetal anomaly, many time what happen, if the fetal anomaly is detected at 21 weeks, 22 weeks, so the 24 weeks tak we can do the MTP if the baby has a problem or mother life is at danger or it is a rape victim or certain special conditions bolte hain, jaise like husband dies during pregnancy or there's a divorce during pregnancy. Yes, only the mother, as long as the mother is mentally sound, only the mother matlab the pregnant lady, okay, consent is required only of the pregnant lady, okay, only of the pregnant mother or pregnant lady will give the consent. But very good, uh, very good, what you said, Jalaram, correct, and the Benji, okay, sir, failure of contraception, and I'm so happy this was there in the last year's January FMG. Okay, okay, please understand this. कि अगर कॉन्ट्रासेप्शन फेल हुआ है, सर कॉन्डम फट गया था, फेलियर ऑफ कॉन्ट्रासेप्शन, यू कैन बी सिटिंग एट होम टिल 24 weeks. So for failure of contraception, it is still only till 20 weeks. Is this understood to all of you? Okay, so please don't make a mistake. This is shortcoming. Okay, sir, for failure of contraception, MTP still can only be done up to 20 weeks of gestation. Yes, guardian in case of mentally ill patient, yes, and if it is any other indication, then we can go up to 24 weeks. Okay, yes, minimum age of consent 18 years. Okay, yes, if the patient is more than 18, then you can give. The last thing, anybody, how many doctor opinion? Okay, so as per the latest guidelines, the new criteria may up to 20 weeks, only one doctor opinion is required. Yeah, if there's no problem, yes, statement very good. Okay, Benji, yeah. Ah, right. So if there's no mother is healthy, baby is healthy, then we can only do till 20 weeks. Okay, and after 20 weeks, basically 20 to 24 weeks, then two doctor ka opinion has to be done. Okay, two doctor ka opinion has to be done. Medical board, that is later on, beta. If after 24 weeks, then you require medical board also. Okay, so two doctors can give the opinion. Yes, correct, very well summarized, Shalini and all of you, all excellent, all of you. Yes, 2024 two doctors. Okay, now again a hot favorite surely aane wala hai. Patient comes to us with 45 days of amenorrhea for MTP. uh, what is the regimen used? Total confusion, and I'll give you a trick. Let me see how many are getting this answer correct. A, C, C, A, C. How many A? How many C? How many D? Yes. So please pay attention. Again, please understand this कि ये total confusion. Clap if you are मैं हूं ना. Okay. So ध्यान से सुनेंगे. All of you please pay attention. This is how the combi pack looks like. This is how the combi kit looks like. What are the two drugs? Yes, budding doctor, very good. Okay, so mifepristone is given first. Is this difficult to remember? Maybe, but I am there. Mifi में F है and first में F है. Okay, so Mifi will be given first. Always please keep that in mind. And then after 48 hours, we will give meso. Meso में S है तो meso is second drug. Okay, second start with S. Clap. ठोको ताली. So this one single tablet is Mifi, but Mifi is 200 milligram. So यहाँ पे meso is not given first. That option out. Meso is not given first. And those who said A is wrong because थोड़ा unit में गड़बड़ हो गया. It is not 200 microgram and meso is not 800 milligram. Perfectly correct. C is the answer because sir Mifi is a single tablet of 200 milligram. And anybody, meso is what? Meso is what? Prostaglandin. Chalo, misoprostol is which prostaglandin? Misoprostol is which prostaglandin? E1, E2, F2 alpha. Each tablet is 200 microgram and we can see 4 tablets in the picture. So that is 800 microgram after 48 hours. Okay. Anybody? Misoprostol is which type of prostaglandin? Yes, okay, excellent. Misoprostol sir is PGE1 analog. PGE1 again ये question surely आने वाला है. Okay, this can be given per vaginally or even sublingual or even oral, but per vaginal. Okay, ane beta Jalaram, F2 alpha is carboprost. Okay, is it clear? Yes. Okay. So moving on to the next MCQ, and we'll discuss that also at the process. Okay. Treatment of decubitus ulcer in prolapse. Very, I would say, recently asked question. Yeah, these are all short question. Yes. Uh, anybody? Decubitus ulcer किसमें होता है? Prolapse में. It's a prolapse in the exposed part of the cervix. Okay, when the cervix is exposed, matlab basically you will get it in 3rd degree and 4th degree prolapse. You will get, what do we do? Okay, what do we do? So remember, we never give laser surgery. We don't give antibiotic. We don't give cryo. We are supposed to pack. And packing is done with what? Anybody? Packing is done with what? So nobody. So the answer is packing with glycerine plus acryflavin. Yes, anybody? What is the glycerin do? So glycerin is a hygroscopic agent. It will decrease the edema. It will decrease the edema. And acryflavin is a yellow color dye with a antibiotic or antiseptic property. Okay, it's a yellow color dye. Okay, is this understood to all of you? Clap if you have learned something new. Okay, is this clear to all of you? Yes. Okay. So is the chat box okay? Yes. Anybody? Can we? Is the chat box all okay? Why? क्या stop क्यों हो गया suddenly? Okay. Yes. So is can I get a thumbs up in the chat box so that I know everything is okay? Are all of you following me? So it is the answer. This is likely to prepare. Packing करते हैं with a tampon. You take a tampon. We take a tampon and we dip it in the glycerin and acryflavin and you pack it inside. Okay. Okay, moving on to the next MCR. All of you understand? Can I get thumbs up? Then I can proceed further. Can I get 3 thumbs up? Then I'll proceed further. Okay, so packing a treatment of Digo ulcer plus very famous MCQ. Packing the ulcer with a glycerin acryflavin tampon. Okay, moving on to the next MCQ. Yes, and before we proceed further, would like to tell all of you can please install my OG Guru app. This is the for Android and this is for the Apple Store. Do not forget to put the ORG code also, and all of you can do this rapid revision MCQ discussion launch. That is the discount coupon code, and all of you please install the app, and it is 16 hours, and if you see at 1.5x speed in 10 to 12 hours. Okay, so basically in 10 to 12 hours. Okay, so it is 16 hours of all MCQ discussion, complete MCQs, complete PYQs, all the most important virgin PYQ MCQs, all will be covered. It is like how today we are for 3 hours, we are waiting 16 hours, and if you see it at 1.5x speed, then all of you are just going to take 10 to 12 hours. That means within 2 days time. Okay, under my guidance, in less than 48 hours, for your FMG examination, you will be able to see all the beautiful MCQs, and it is at extremely low cost of rupees 448 only. So I request all of you to install the OG Guru app and make use of me, and I'm personally guiding all the students how to study, how to prepare. Is this understood to all of you? Yes. Okay. So moving on to the next MCQ, and which is the what is this instrument? Anybody, what is this instrument? And this device is least likely to be used for. The question is the device is least likely to be used for. Yes, yes. Yeah, thank you. For some time, the chat functionality was not being seen on my phone, so I got slightly confused. Yes, so all of you, yes, no, no, not stopped. Okay, yes, great. Okay. Uh, uh, Dr. Ruhi, the code is asking is this, okay, the ORG code, just to tell this is the ORG code, okay, YYMSTY. Launch 30 is the discount code, YYMSTY is the ORG code, okay, Dr. Ruhi. YYMSTV. Sorry, YYMSTV. YYMSTV is the code. I'll show you again, okay, later on. Yes. So yes, very good. All of you correct. This is the uterine sound, and uterine sound किसके लिए काम आने वाला है? Yes, to measure the uterocervical length. Okay, uterocervical length. So we put it basically inside the uterus. We put it inside the uterus. So I will know okay, how much is the uterocervical length. How much is the uterocervical length? So for any condition where we are going to put any instrument inside the uterus, it is the uterine sound. The instrument is uterine sound. Uterine sound. So any condition where, yeah, thank you, Roy, the old gamer, for helping others. Yes. Okay. So all of you, please pay attention. DNC, definitely I would like. Anybody, what does this instrument do? Why is it important to know the UCL? Why is it important to know the UCL? So that we do not perforate the uterus. Beta, all in one, you are getting confused. It is the question least likely. So IUCD insertion, yes, I will want to measure the UCL. Suction, evacuation, dilatation, curettage, also I would like to measure the UCL. Isn't it? Beta, all in one, समझ में आ गया? So all these cases, yes, I need to know the UCL. Okay, removing of the IUCD. How do I remove the IUCD? Yes, Amritpal, to prevent rupture, because if I put the instrument excessive inside, I'll cause perforation. Okay, okay, to perforation. Okay, so to avoid perforation, we should know the UCL. Okay, you got it. This one, beta. Yes, okay. Is it clear? You got it? All in one, all in one. समझ आ गया? तो removing the IUCD, the question is least likely. तो IUCD कैसे remove करते हैं? All of you know this. Okay, sir, this is the uterus, this is the copper T, and IUCD is just threads are hanging over here. I just have to pull it with the artery forceps. Okay, so just take a artery forceps or take any grasper and just pull it out. Okay, pull it out. So uske liye I don't need to sound the uterus. Okay, I don't need to sound the uterus. Is this absolutely crystal clear to all of you? So IUCD insertion you require, and suction, evacuation, and dilatation. Yes, yes, perfectly correct. Yes, so we all these questions are also available. They are saying with all the this. Now, which kind of a filter is there? Colposcopy. Again, a PYQ. Again, this has been asked in the FMG examination. What filter is used, and with what colposcopy we use a filter. So colposcopy is done in cases of when the pap smear is abnormal. Colposcopy gives us magnification. Very good. Green filter is used to see the blood vessels. Excellent, all of you. Okay, to see the blood. All of you, I think, are really very well prepared, and all of you are going to do very well in the upcoming exams. So green filter mein the blood vessels are seen very nicely, and blood vessel will be seen like dot 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 punctate pattern. Okay, because neovascularization. So just remember colposcopy green filter. Nothing filter, but it's like a green color light. Okay, it's just like a green light. Okay, you put a green color screen, you put a green color screen on front of it so that everything appears green color. Thank you FMG aspirant, thank you for your love and appreciation. Okay, so just remember colposcopy is to take the cervical biopsy, but green filter is used. Biopsy ke liye we apply acetic acid. Okay, we take the biopsy from the acetoid area, green filter to see the blood vessels. Okay, again very simple popular image. So all these are previous year's question. Okay, identify this. What is this? Yes, so this is a patient who has been treated with ovulation induction agents. Identify the USG. So here what we can see, yes, okay. No, but green is what is clues. Okay, green is what you remember. Okay, yes. So, sir, here we are seeing the big bulky ovary. All of you, excellent. Will not waste time. Multiple big follicles, and this is specifically the history of ovulation induction agents. Which ovulation induction agent? Anybody? So remember, when not clomiphene, not letrozole. Okay, clomiphene letrozole में इतना नहीं होता है. Specifically when HMG gonadotropins or recombinant FSH is used. Okay, so gonadotropin injection is used to make the multiple follicle, and specifically when HCG is the main culprit. HCG is given as a final trigger, and along with this, yes, overstimulation. Actually, along with this, you should also see ascites. Okay, free fluid will be there, ascites. Now just don't get confused. Why is it not PCOS? Anybody, why not PCOS? Why this picture is not PCOS? Quickly. Yes, very good, Ridwan Bharti. Okay, why is it not PCOS? Because sir, in PCOS you will get multiple small follicles. Okay, छोटे follicles, multiple small follicles arranged in the periphery. So when I see small follicles and small follicles in the periphery, that is PCOS. Okay, necklace of pearl pattern. Yes, excellent, all of you. So यहाँ पे all we can see big follicles. Okay, big follicle in the center. Absolute contraindication for IUCD is, absolute contraindication for IUCD is, okay. Yes, all of you correct. So remember, past history of PID is a relative contraindication. Again, unnecessarily, the ectopic is blamed for, the IUCD is blamed for ectopic. Ectopic is not going to be increased in past history of ectopic. कोई issue नहीं है. Menorrhagia you will avoid. Okay, is a relative contraindication. Menorrhagia, dysmenorrhea, very good. Undiagnosed vaginal bleeding, undiagnosed vaginal bleeding, and specifically of course pregnancy, acute PID. Okay, बाकी आपको acute pelvic inflammatory disease, puerperal sepsis. Okay, puerperal sepsis, all this infection, distorted cavity, all these are going. Yes, all of you correct. Again, very simple PYQ, but don't make a mistake. Okay, moving on to the नेक्स्ट पार्ट. हाँ, कि जो मैंने बताया मिफीप्रिस्टोन मिसोप्रोस्टॉल स्टिल हाउ मेनी वीक्स, एंड 10 वीक्स पेशेंट, 10 वीक्स प्रेगनेंसी फॉर MTP. What is the best method? Anybody? Yes, anybody? Yes, very good. Can anybody tell me this mifepristone misoprostol combination is allowed only up to 9 weeks of gestation? Okay, only up to 9 weeks of gestation, and therefore here the question is 10 weeks. I don't, this is outdated kachra, and you don't have to do MTP contraindicated just because she is unmarried. You don't have to inform the police. No, inform the police when it is under 18 years. If it is a teenager, if it is basically minor, age 16, 17, then you might have to inform the police, but still you go out with the MTP. So the answer is very good. When the pregnancy is 10 weeks, 11 weeks, up to 12 weeks, perfectly correct. Somebody said excellent. Sir, I would go for suction evacuation or MVA. Okay, you don't have to say that MTP is contraindicated and inform local, just because so many young girls to 19, 20, 21 come to us, they are unmarried, they get pregnant, we have to help them out. Okay, is this understood to all of you? So police inform, you need to inform police only when the girl is minor. Okay, yes, moving on to the short topic. Yes, 19 minutes. Yes, okay. So grayish white discharge with a positive whiff test. Chalo, short आने वाला है MCQ. What is the diagnosis? What is the diagnosis? What is the diagnosis? Yes, so this is our bacterial vaginosis or BV. Gardenella. There are more questions regarding this also. So we'll also discuss the AM cells kind of thing and bacterial vaginosis. Okay. Uh, the answer is metronidazole. Metronidazole is the drug of choice. Flucon is for fungal infection. Okay, fungal infection we go for flucon. Okay, excellent, all of you. Okay, is this understood to all of you? Positive whiff test. What is the whiff test? So the whiff test is, let's say, on adding vaginal secretions, we add 10% KOH and we get a fishy odor. We get a fishy odor. Yes, AMSEL's criteria we're going to discuss in MCQ also, in presence of clue cell. Excellent. Okay, so moving on. Yes, again a difficult clinical case based scenario. Chalo, tough MCQ. Now tell me the answer. Patient had an incomplete abortion. She underwent a check curettage 4 months back. She has come to us with amenorrhea and FSH is 5. Now, can anybody tell me what is the FSH5 telling you? Simple, पहले अगर FSH5 दिया है, very good. But खाली just because there's a history of curettage. Yes, very good. लेकिन Asherman, sorry, FMG aspirant, I'll tell you how you can get fooled. Okay, yes, history of curettage very likely to be Asherman, but sir, FSH5 is normal. Okay, FSH5 is normal. So remember students, anybody? So remember this, कि if in your case आपको ना FSH दिया तो anything more than 3 basically 4 5 मतलब basically 4 5, ओके 4 5 to 10 12 ये आपको नॉर्मल समझना है. Okay, is this clear? Yes. If they want to say FSH low, they will say less than 1. Okay, so they'll tell you FSH is 0.5, FSH is 0.3, basically anything under 1. This sir, FSH is very very low. And when they will say sir FSH is 20, 30, 40, you consider FSH is very very high. ये समझ में आ गया. Now clap if you feel happy. Master servant relationship. Okay, sir, in intrauterine gynae, the ovary function is normal, so the FSH is going to be normal. Can anybody tell me, if it is a ovarian failure, what will happen to the FSH? When the ovaries will fail, if the ovaries will fail, master will shout more loudly कि बाबा काम करो काम करो काम करो, and therefore in ovarian failure FSH is going to be very very high. Yeah, 3 to 12 you can consider. And if the master himself is sleeping, then the pituitary failure FSH will be very, very low. Do you agree with me? Okay, so all of you, yes, history of curettage दिया है करके we are tempted to mark uterine synechiae because repeated curettage can cause synechiae, but don't get confused. Is it clear now, all of you? Tell me the answer. Tell me the answer. Suppose I make this MCQ and I say FSH is 50. Now what is the answer? Yes, very good, Shubhang Lalit. That sir, if the FSH is 50, yes, okay, कि सर if the FSH 50 दिया है तो भले हिस्ट्री होने दो. Yes, excellent. And if they say FSH is 0.5, FSH is 0.5, तो आपका आंसर होगा पिट्यूटरी फेलियर. Yes, so just don't get confused कि ये चेक क्यूरेटाज का हिस्ट्री है. Yes, keep in mind that this is a scenario. Okay, sir, FSH5 is considered normal and the answer is intrauterine synechiae. Intrauterine synechiae, this is going to be ovarian failure, I repeat, very, very high. Pituitary failure, FSH, very, very low. Thoko tali. Okay, moving on. Fothergill repair is associated with all of the following. So, anybody, Fothergill surgery is for what? Fothergill repair is for what? Fothergill surgery is for was a outdated surgery. अभी नहीं करते हैं. What is better now? Medico diagnosis of menopause more than 40. Yes, more than 40. FSH more than 40. Yeah, 50 is menopause. Correct. Fothergill surgery is for prolapse uterus, but nowadays we don't prefer it. We don't prefer it because in Fothergill repair, what is the main step? So in Fothergill repair, the main step is what? Cervical amputation. Okay, again a short MCQ this is. Okay, so sir, we chop off the cervix. So when I chop off the cervix, cervical amputation kar diya, so either there is cervical stenosis, cervix will become too tight, which can cause infertility. Okay, it can cause infertility. It can cause cervical dystocia. So during labor, the cervix will not dilate. Okay. Now I'll tell you what we do. Okay. And very good. So cervix can also become loose and can cause cervical incompetence. And if there is cervical incompetence, what will happen? What will happen is, okay, sir, cervical incompetence में second trimester abortions. Okay, yes. Cerclage is the treatment. Cerclage is the treatment for cervical incompetence. Okay, is it understood? Yes. So okay, so dystocia मतलब cervix face to dilate and cervical incompetence, so second trimester abortion, preterm labor, ये सब हो सकता है, but the answer is second trimester and not. Anybody, what are the cause of abortion in the first trimester? Yes, so the हाँ बेटा repeat कर रहा बेटा. Okay, so Fothergill repair is associated with all of the following complication except first trimester abortion, because keep in mind, yes, कि सर basically Fothergill से होगा, सर्वाइकल एम्प्यूटेशन करते हैं, सो सर्वाइकल इनकॉम्पिटेंस, And whenever there is cervical incompetence, the abortion will always take place in the repeated painless second trimester abortion. Is this understood to all of you? Yes. First trimester is chromosomal, genetic, Apla syndrome. Very good. Is it clear? FMG aspirants समझ में आ गया बेटा? Yeah, PDF will send it. Okay, PDF will send it. I'll also post the PDF on the Telegram. So all of you, join the Telegram channel also. PDF will be uploaded in the Telegram also. Okay, so I will post the PDF of this whole chapter in the okay. So basically cervical incompetence se hoga repeated painless second trimester abortion, and therefore what is preferred is, so it was done with young patient. Okay, young patient of prolapse, Fothergill was done, and now all of you know how will you remember? Sing is king. So sling surgery. Okay, sling surgery. ओके, स्लिंग सर्जरी इज बेटर. कैसे याद रखेंगे? अक्षय कुमार मूवी आया था 15 साल पहले, सिंग इज किंग. सो ऑल ऑफ यू विल रिमेंबर स्लिंग इज किंग. ठोको ताली, क्लैप. Sling is king. Sling is king. Basically, sing is king. Sling is king. Okay. After your exam is over, you can see the movie. Now, don't waste time in seeing the movie. Okay. No, but infections will not cause repeated abortion. Okay. Is it clear to all of you? Infections will not cause repeated. Okay. So sling is king because once you get infection, there is lifelong immunity. Most of it. Okay. So sling is king. Okay. इज इट क्लियर? सो बेसिकली सर्वाइकल इनकॉम्पिटेंस होगा, सेकेंड ट्राइमेस्टर होता है. ओके, एंड यहाँ पे फर्स्ट दिया है, दैट इज द आंसर. ओके, नाउ वेरी वेरी इंपॉर्टेंट previous year question. January FMGE. RH negative mother has undergone an abortion or a MTP at 11 weeks. Do I need to give anti-D? And if at all, which dose do we give and how much do we give or we don't give? Okay. Okay, so first of all, remember, my dear students, all of you wrong, all of you wrong. Okay, suno. Pehli baat. Now, whenever I want to give anybody, what is the role of anti-D? Anti-D injection kya karta hai? And when do I give anti-D? Okay, so remember this. Okay, what is the role of giving anti-D? Sir, the anti-D injection what I give, basically anti-D coats the fetal RBC. Okay, ये fetal RBC है. Anti-D acts like a policeman. Clap if you learn something new. Anti-D, बेटा ये नीट पीजी का लेवल का क्वेश्चन है. यस, यू आर करेक्ट. दिस इज नीट पीजी एज वेल एज एफएमजी. ओके, दिस इज फॉर डेफिनेटली फॉर नीट पीजी. ओके डॉक्टर साहब. यस, so anti-D basically coats the fetal RBC and prevents them from stimulating the maternal immune system. Okay, and the anti-D, basically the role of anti-D is to prevent. Is this clear to all of you? To prevent the antibody formation. Okay, is this clear to all of you? The anti-D role is to prevent the antibody formation. Okay, but if the antibody is already formed, that means the fetal RBC, if the fetal RBC will go and stimulate the maternal immune system, and if the antibody is already formed, okay, if the antibody is already present, then anti-D has got no role. I want this concept to be going in everybody's brain. I repeat, that sir, the anti-D role is to prevent the antibody formation, but if the antibody is already present, then there is no role for the anti-D. Okay, is this understood to all of you? And therefore, when do we give this case, sir, the mother should be Rh negative, the father or the husband? Okay, father bolo, husband bolo, partner bolo should obviously be Rh positive. It is understood. Okay, yes, and father or the, and what about ICT, indirect Coombs test? Anybody before I give? Beta grade 6, how many questions you can expect? All 14, 20 में से 20. Beta, you go for my masterclass FMG, all 20 questions will be coming from that session only. Okay. Okay. Yes. So now anybody, ICT क्या होना चाहिए? ICT should be what? ICT should be negative. ICT should be negative. Okay, ICT should be negative because ICT negative means that the antibody is not yet formed. Okay, Piyush Thakkar, nahi, ICT should not be positive. The trick MCQ. Okay, ICT should be negative. Then only I will give anti-D. Is this clear to all of you? And please, my dear student, the answer is not 300. The answer is 50 microgram. Clap if you have learned something new. Okay. Okay, is this understood to all of you? Is this understood to all of you? Because we are in the first trimester. Okay, so when the patient is in the first trimester, please understand ICT. Yes, very good. Then only we give the hand. Very good, Bharti. Okay, so is this understood to all of you? Clap, all those who have learned something. I'll tell you when is the answer 300. Okay, so anything. So remember this, that's our ICT. Yes, it is less in the less than 12 weeks. Why? Yes, that is why. Okay, because the chota baby hai. Okay, so now please understand this, that why, ये क्या logic है? Anybody, you will get the logic today. Okay, what is the logic? The logic is हाँ 300 कब देंगे बता दो. The logic is that sir, after birth of the baby, after the baby is born, okay, after the baby is born, I will do the baby blood group. Is this understood to all of you? We will do the baby blood group, and if the baby is Rh positive, then I give ICT beta, indirect Coombs test. Okay, indirect Coombs test. Okay. Okay. Okay, so baby blood group is Rh positive. Then after the baby is born, here I give 300 microgram anti-D. Is this understood to all of you? So here, sir, after the baby is born, I can do the baby blood group. Okay, but sir, in MTP, I can't find out the baby blood group. So it's assume. You assume that the baby which I sucked out or which MTP, the baby is positive. Okay, the fetus is positive is an assumption, and you will give 50 microgram, anything in the first trimester. Dr. Saab, you got it. 300 कब देंगे? So 300 we will give after birth of a baby. I will give 300, or anything to do in the second. Okay, anything to do in the second trimester MTP. Okay, then also I will give 300 microgram. Clap. I want 10 claps or thumbs up, then I will proceed further. Is this understood to all of you? Okay, so please focus on what is it clear to all of you? Okay, so ICT should be negative. I repeat, indirect Coombs test should be negative of the mother. ICT of the mother. Okay, then only there is a role of giving anti-D injection. Okay, ICT mother का negative होगा. Mother is Rh negative, father is Rh positive. The 300 is the answer if anything is in the second trimester. 300 microgram is the answer if they tell you the abortion happened at second trimester, or ectopic, anything in the first trimester, 50 microgram. Okay, moving on to the next very simple ovarian torsion. Ovarian torsion के लिए what is the investigation? Last 1 hour we'll have to be very quick, students, and now more superb MCQs coming up. Yes. Okay, sir, for torsion, I want to see the blood supply because, sir, the CT scan MRI will tell us about the ovarian mass. But torsion, because when there is a torsion, necrosis ka chance hai, the blood supply will get compromised. And therefore, color Doppler, please, this again a PYQ, because blood supply of the pedicle, when you twist, okay, when you twist it, the pedicle will get twisted, the blood supply is going to decrease, and color Doppler is to be done for ovarian torsion diagnosis. Is this understood? Short PYQ, tell me the answer. Anybody? Anybody? Yeah, an ovarian torsion, immediate surgery required. Okay? Yes. Chalo. Now, anybody, what is the diagnosis? Very important PYQ shortly coming in the exam. What is the diagnosis, sir? I have got a patient. BP is 180, 110, albumin is +4. So we are not only having severe preeclampsia, but along with severe preeclampsia. No, it's not eclampsia. Okay, beta, budding doctor, convulsion has not come. She is having headache, blurring of vision, oliguria. Very good. So this is impending eclampsia. In impending eclampsia, please understand this. आपने हिंदी पिक्चर में देख, why I am calling it impending eclampsia? Because of the dangerous symptoms. What are the dangerous symptoms? Headache, blurring of vision, oliguria, and two more if they give you epigastric pain and nausea and vomiting. Okay, so these are the dangerous symptoms. Okay, now प्लीज अंडरस्टैंड दिस. आपने हिंदी पिक्चर में देखा होगा, डॉक्टर लेबर वार्ड के बाहर आता है और डॉक्टर फेमस डायलॉग बोलता है, हम माँ और बच्चे में से किसी एक को बचा सकते हैं. हैव यू हर्ड दिस डायलॉग बिफोर? फिर किसको बचाना है? माँ को बचाना है, बच्चे को बचाना है, सेव द डॉक्टर, सेव द लायन, सेव द चीता, किसको बचाना है? ओके, खड़ूस सास बोलेगी बहू को मरने दो, बच्चे को बचा लो. लविंग हस्बैंड बोलेगा नहीं नहीं सर प्लीज मेरी वाइफ को बचा लो. सो प्लीज अंडरस्टैंड दिस. Who is more important? Have you heard this dialogue before? Yes. So please understand this. Why I am telling you this is, okay, sir, in the question paper, we are only 31 weeks. So many of you are thinking that I will either wait and watch or I will wait till 36 weeks. No, you will never wait and watch in this situation. Okay. In this situation, when it is a impending eclampsia, you will never wait and watch. Very good. Beta, MgSO4 here is given for prevention of convulsion, not only for neuroprotection for the baby. That is okay. But here, okay, you let the question be 26 weeks, 28 weeks, 32 weeks or 36 weeks, the answer will not change. Why we give Maxself? This is prophylactic magnesium sulfate to prevent convulsion. And again, after giving Maxself, you will never wait and watch, never WW. And immediately, anybody, what is the definitive treatment? So delivery has to be done. Delivery is the definitive treatment. Is this understood to all of you? 10 thumbs up. It's a delivery has to be done because delivery is the definitive treatment, otherwise the mother will die. Similarly, if the question is of eclampsia, this question is surely coming. Agar eclampsia bhi hai, then also I will give Maxself and then I will proceed for delivery. You will induce the labor. Okay, never directly do LSCS. So the answer is Never direct LSCS. Labetalol, yes, I will give, but then never wait and watch. And I will again give Maxel, but again not wait and watch. Answer is option number 4. 10 thumbs up. I will then only proceed for this. So Maxel, labetalol, and immediately induction of labor, because the delivery is the definitive treatment and the delivery should be done irrespective of weeks of gestation. Irrespective of weeks of gestation, we proceed for the delivery. Let the question paper be 26 weeks, 28 weeks, 32 weeks, 36 weeks. So the baby, माँ और बच्चे में से माँ को बचाना है. Mother is more important. If the baby cannot be saved, it is okay, fine. Mother है तो पीछे पूरा क्रिकेट टीम आ सकता है. Yes, is this understood to all of you? So you cannot wait. And this very simple again. अब surely ये क्या है? प्राइमरी अमेनोरिया. प्राइमरी अमेनोरिया, साइक्लिकल पेन. के डॉक्टर पेन हो रहा है लेकिन कुछ बाहर नहीं आ रहा है. एंड एपिसोड्स ऑफ यूरिनरी रिटेंशन. एंड व्हाट इज दिस? Yes, all these questions are like that. Yes. What is this? This is the, yes, all of you correct. So this is very important. This is the imperforate, because bluish tense bulging hymen. Okay, bluish bulging hymen. Nothing more to discuss. Imperforate hymen hai. And the treatment, yes, all of you, cruciate incision, because the blood is basically cryptomenorrhea. This is the topic of crypto, again a PYQ, cryptomenorrhea. And yes, I hope बेटा 99% आएंगे. I hope 100% आएंगे. I just hope all questions you get. Okay, imperforate hymen, very likely, okay, to be coming in the exam. And this is because this hematocolpus will press the bladder, so urinary retention भी होता है. So whenever they give you cyclical abdominal pain and primary amenorrhea, think of cryptomenorrhea. Okay, very simple long question, but क्या है answer? Okay. Pregnant lady is 32 weeks pregnant. Okay, and when I do the sonography, the age is only 29 weeks growth. So basically, what is this? What is this? ये क्या है? Discrepancy. Baby is smaller. So what is this? This is IUGR. Yes, sir. Baby has grown only up to 29 weeks, but the patient is actually 32 weeks. So perfectly correct. Preeclampsia, hypertensive disorders, any infection, infarction, diabetes में तो baby will be big. Yes. Yes, cruciate, beta, cruciate like this, cross plus cross incision. Okay, is it clear, beta? Yes, and therefore in diabetes to we get a big baby, chota hathi, like a macrozomy, big baby. Okay. Yes, because which of the following? All except pucha hai. Very good, all of you. Large baby in diabetes. Excellent, all of you. Nothing further to discuss. Okay, again short repetition. अभी फटाफट कुछ ज़्यादा discussion नहीं है. Which is not true for trisomy 21? NT is more. PAP A could be less. Alpha fetoprotein is also less. All of you know HCG will be higher than normal. Okay, HCG will be higher than normal in trisomy 21. Okay, is this understood to all of you? Moving on. In emergency contraception, we can use all of the following except. So again, not much. Yes. Okay, not much to discuss over here. that, sir, LNG 1.5 milligram I can use for emergency contraception, IUCD also I can use, and ulipristal is a new drug. Ulipristal is a new drug, selective progesterone receptor modulator. I can use it up to 5 days. Misoprostol is not for emergency contraception. It is for MTP, already discussed. Okay, yes. So we'll go far, and what is already discussed will not waste time. Okay, ulipristal can be used up to 5 days. Okay, up to 5 days of unprotected intercourse we can go. Okay. Okay, moving on to the match the column. Again थोड़ा repetition है, थोड़ा easy है. Okay, McAfee and Johnson, I told you, is the conservative management for placenta previa. So 4D, 4D, 4D. Okay, Woods maneuver is for shoulder. Just the name you will remember. Woods maneuver is for shoulder dystocia. Okay. Okay, yeah, 4B, sorry, 4B hai, yes. Okay, so that is, okay, 4B. Okay, yes. So, 4, okay, yes. Wood's maneuver is for shoulder dystocia, 2F. Okay, 2F, 2F, okay, but 4 is B, 4 is B, yes, all of you, okay. I'll tell you all the maneuvers who told me for shoulder, okay. And Burns Marshall is for after coming head of the breech, 1C, 1C. Yes, so 4 is the answer. And covular uterus you see in cases of abruption. Yes, covular uterus is basically the blood enters in between the myometrial fibers. Shoulder dystocia ke liye the two most, yes, so this is the answer, all of you keep in mind. Okay, shoulder dystocia, the three maneuvers which we should know is in shoulder dystocia, one we always give suprapubic pressure, and if not then we do the Mac Roberts. Mac Roberts is hip hyperflexion. You hyperflex the hip onto the maternal abdomen, and Mac Roberts maneuver is also for shoulder dystocia, and Wood's maneuver is also for shoulder dystocia. Just the names we are supposed to remember, details we are not supposed to remember. Okay, yes. Moving on. Again, a very simple clinical case scenario. What is the diagnosis? Anybody? What is the diagnosis? Yeah, in last, Shubhangi Lalit last. Yes, Zavelani is also last option. You do Zavelani and then proceed for LSA. Zavelani will have to deposit the head back inside the vagina. Okay. Now, anybody got the diagnosis? So this is your uterus. Patient starts to bleed and uterus is flabby. So sir, this is atonic PPH. Atonic PPH. Oxytocin is the first drug of choice. Oxytocin is the first drug of choice. Misoprostol of course can be given, and methergin can also be given, and which one more, PGF2 alpha can also be given. So all this injection PGF2 alpha can be given. Mifepristone is the answer. Mifepristone has got no role. Anybody, what is this? हाँ, रिदवान खान बताते हैं. Okay, all except. Question is all except. Okay. So very good. 4 is the answer. So anybody, what is carbetocin? Clap if you have learned something new. OG in the chat box. What is carbetocin? Sir, carbetocin is the latest drug surely coming. Carbetocin is basically the oxytocin derivative, but oxytocin gets destroyed in the heat. So ये carbetocin is a new drug. It is stable at room temperature. Okay, so carbetocin is a new. No बेटा, शुभांग, ऑक्सीटोसिन प्लस अर्गोमेट्रिन कॉम्बिनेशन नहीं है. Okay, it is a oxytocin analog. It's oxytocin analog, but it is stable at room temperature. Okay, and carbetocin is also used. It's a new drug, so please keep in mind this is very new. Mifepristone, all of you know, is mainly only for MTP, and we are not going to use it for this. Yes, thank you. Okay, is it clear to all of you? So याद रखेंगे. Okay, and lastly, remember, can anybody tell me methyl ergometrin or methergin? Methergin, absolute contraindication. Which condition? Okay, heart disease patients. Heart disease and hypertensive disorders. If the patient BP is high, I will not give methergin. Again, PYQ. Can anybody tell me PGF2 alpha, the carboprost, what is the absolute contraindication? Bronchial asthma. Okay, bronchial asthma, if it is there, then it becomes the absolute contraindication. Okay, is this understood for all of you? So these are all the previous year questions surely coming in the upcoming exam. Do not make a mistake in this. Anybody, what is the diagnosis? Uterus empty. Okay, forget the pseudo. Uterus is empty. So when the yes, okay, anybody? So what is the diagnosis? Sir, I have got a patient, again a clinical case scenario. She is 2 months amenorrhea, uterus is empty. We are seeing a 2 by 5 into 3 centimeter mass, beta HCG 1500, pulse BP normal. What is the diagnosis? Sir, methergin is used for PPH only. Methergin is a drug for P. Okay, yes, Pratik, methergin is methyl ergometrin. Yes, very good. But can anybody better the answer? Yes, it is ectopic pregnancy. But anybody unruptured ectopic? Why unruptured ectopic? I am saying because the patient is stable. Okay, patient is stable. And when the patient is stable, for ectopic, no, you never wait. Repeat USG is done only when the diagnosis is doubtful, and you don't wait for 2 weeks. In these 2 weeks, the ectopic will rupture. Okay, you don't wait so much. Okay, so you don't wait. This is wrong. Okay, yes, methotrexate is the answer. You never wait and watch. And surgery is only done when it is a ruptured ectopic or when methotrexate is not possible. Okay, so methotrexate के लिए क्या criteria है वो भी discuss करेंगे. The patient should be stable and the sac size should be, anybody, the HCG level should be less than 5000, and the gestational sac should be less than 4 centimeter. Okay, yes. No, rupture is not ring of fire, but unruptured is ring of fire is in ectopic. Okay, yes. Heartbeat should be okay, yes. So is this understood to all of you? Gestational sac is less than 4 centimeter. So basically, will okay. Then and the HCG level should be less than 5000 micro international units per ml. Okay, and of course, most important, patient stable. That is the most important. Then only I can think of giving methotrexate. Is this understood to all of you? Yes, single dose intramuscular. Okay, ये तीन याद रखो. Gestational sac less than 4 cm. Moving on, this again should not be a confusion. Again, this is a very famous MCQ for all of you. Chalo. So all the best MCQs we have selected, and we are Yes, anybody, what is this? So please understand this. A, the previous history of twins will not affect the G and the P. Is this understood to all of you? Unruptured ectopic? No, beta. Why will it unruptured and unstable patient? Okay, Pratik. Unstable patient matlab ruptured ectopic. Yes. So please understand this, that when the patient is pregnant for the first time, okay, gravida 1. Now here she has twins. Here she has twins. So no problem when the pregnancy crosses 28 weeks and after delivery the twins, she is only P1 L2. L2 matlab two babies. Okay, so para 1. So basically twins में G will, it's not कि दो baby है तो G1 G2 दोनों हो जाएगा. Okay, yes, twin is counted as single only, and now when she becomes pregnant for the second time, she is G1 P G2 P1 L2. Okay, what does G2 P1 L2 means? Her second time pregnant, one delivery, two babies. Okay, so she is not G3, she is not G3, she is G2, but G2 P1 L2. L2 matlab both the babies are living. Very good. Twin is counted for purpose of G and P. It is not P2 कि दो बेबी का डिलीवरी हुआ लेकिन पैरिटी इज ओनली वन. यस, लिविंग टू होता है L2 if both babies are living. Okay, so let's not make a mistake in this, and don't make a mistake in this. You all should get this correct. Okay, now again very fascinating, again a difficult PYQ आया हुआ है. Twin baby. Okay, या ओके, वन बेबी फादर का है, वन बेबी उसका नहीं है. एक बेबी फादर का, एक बेबी बाजू वाले का. ओके, ऐसा पिक्चर भी है बुक में. ओके, व्हाट इज द डायग्नोसिस? सो बेसिकली रिमेंबर के सुपरफिटेशन is not possible in humans. Okay, not possible in humans. Very good. What is this answer? Superfecundation. Superfecundation means two eggs, two eggs are released in the same cycle, but they are fertilized in the different act of coitus. So morning में, night में the wife has sex with the husband and one baby हो गया. Morning office time husband leaves and the neighbor enters. Okay, and second sperm. So there are two acts, two different acts of coitus. Okay, two different acts of coitus. If it's with the same partner, pata bhi nahi chalta hai, but that is superfecundation, which is the answer over here. In such cases, one baby is of the husband, one is of the other partner. Okay, superfetation matlab one baby is already growing and then there is another ovulation, which is not possible in humans. Okay, so mostly in animals. Yes, so superfetation mein one baby already starts to grow, one baby is already implanted, one baby is already implanted, and then the egg is again released in the next cycle. Okay, and then the next baby is also fertile. That is not possible in humans. Okay, so that is not possible. Yes, very simple. If indomethacin is given in management of polyhydramnios, yes, we give it, but we always prefer to give it less than 34 weeks, because if I give it at 36 weeks of gestation, what is the complication which we can get? Yes, premature closure of ductus arteriosus. Nothing much to discuss. Okay, sir, it is a NSAID, indomethacin, NSAID, and it can cause premature closure of ductus arteriosus. Whenever I have a patient who has a lactating mother, so LMP is not known because patient has conceived in lactational amenorrhea and UPT directly positive. Okay, then What is the best way to calculate the gestational age? Anybody? Gestational age, how do we calculate? Yes. So here the answer is we go for the dating scan and crown rump length done in the first trimester. Dating scan is not when you take your girlfriend on a date and do her sonography. We get such answers in Viva. Okay, it's a dating scan. The during dating period, boyfriend will do girlfriend scan, girlfriend will do boyfriend scan. That is not dating scan. So crown rump length or the dating scan is the most accurate. Okay, it is the most accurate or most reliable when there is doubtful with the LMP. So we use the crown rump length in the first trimester, and this is called as the dating scan. Okay, moving on to the next thing. And before I go for the last time, yes, please, all of you, do not forget to follow me on Insta. Every day I am posting PYQs, and all of you start following the YouTube and see the rapid revision video जो कल post किया था, and Telegram also you can join so that you can post me your doubts, and this PDF also I'll upload over there. So all of you please follow on Instagram. Every day superb MCQs we are posting on Insta also. Okay, there's the last thing, all of you can go for the app if you want to, and you will be able to, yeah, but I'll explain. Okay, Harshudin, I'll explain. Beta kal ka video I'll explain in detail. Okay, tomorrow's video towards the ending you can see, but today also I'll see. Okay, and this is the app available. Notes are also available. This is the code, and all of you can revise the entire OBGY in less than 2 days time. Beautiful notes are also available, and time is there. Okay, time is also there, and there is, you can also go for the master class. Get in touch with me. I will tell you how to study and how to prepare for the upcoming examination. Okay, moving on. नहीं नहीं, अभी बाकी है बेटा. Yes, preconceptional counseling. If the patient has come to us, which of the drug is to be avoided? Okay, so all of us know labetalol is okay, nifedipine is okay. Yes, ACE inhibitors are to be avoided because they will damage the fetal kidney, and there is going to be development of severe oligohydramnios, and fetal renal problem is there, so we do not give it. Okay, again, very simple. This is like a revision. Okay, I have a patient, BP 150 100, protein urea. So patient is preeclampsia. All of the following are the complications which can happen except. So eclampsia can happen, HELP syndrome can happen, abruption, macrozomy नहीं होता है. Sir, with preeclampsia there is risk of development of IUGR. Okay. Yes. Okay. IUGR is a complication of preeclampsia and not your macrozomy. Macrozomy we get with gestational diabetes. Okay. Yes. All of the following are decreased with OC pill except. Okay. So OC pill से ectopic कम होता है. Ovarian cancer also कम होता है. PID and PMS also becomes lesser. Hepatic adenoma increases. Okay, all of the following decreases except the what is increased. Okay, so please keep in mind that hepatic adenoma will increase. Okay, hepatic adenoma will increase with this. Okay, now what is this clinical case scenario? Clinical case scenario: infertility, dyspareunia, dysmenorrhea. तो DID, एनीबडी DID किस में है? DID is a typical triad you see in endometriosis. Dance India dance. Okay, clap if you feel happy. Okay, dance India dance is the mnemonic for endometriosis. And what are we going to get in laparoscopy? Yes, all of you correct. Sir, we will get a chocolate cyst and adhesions in the pouch of Douglas. Okay, in endometriosis, you get lots of adhesions, blue color lesion, red color lesion. Okay, blueberry, red, purple, fruit salad you get, and you also get basically chocolate cyst and adhesions. Excellent, all of you. DID is a symptom of this. Now, very, very important, I have got a 47-year-old patient. ध्यान से सुनेंगे. So she is perimenopausal and there is severe menorrhagia for the last 3 months. What do you do in the management? Okay, so remember, my dear students, this madam, I take a feel 34. Okay, 34 you can mark. 34 to 36 weeks maximum like her. Okay. Yes. So please understand that this 2 centimeter wall fibroid is just given to fool you. A 2 centimeter anterior wall fibroid will never cause menorrhagia. So no point doing myomectomy, hysterectomy directly. Please understand this. You need to find out that the bleeding is from inside the uterus, lining of the endometrium we need to see, and keep in mind okay, DNC will be done first. Why never direct hysterectomy? Okay, why never direct hysterectomy we do? Because if you do directly hysterectomy and the report comes out to be cancer, we have done a inadequate surgery. Is this understood to all of you? So first I will always do first a DNC. Very good. Why? Because remember this, that whenever any patient is perimenopausal, okay, whenever any patient is perimenopausal, in such cases histopathological examination of the endometrium is mandatory. Why I need to do HPE mandatory? Keep in mind HPE mandatory because I need to rule out. You need to rule out endometrial hyperplasia, endometrial cancer first. Is this understood to all of you? Clap if you have learned something new. I repeat that, sir, whenever any patient is perimenopausal, first do HPE, that means histopathological examination of the endometrium to make sure that there is no cancer, and then I can do hysterectomy. Never directly go for hysterectomy. Okay, and here this 2 centimeter fibroid is just given to confuse you. 2 centimeter anterior fibroid will not cause menorrhagia. Okay, she's having menorrhagia. So this 2 centimeter fibroid is not the cause for menorrhagia. Yes, afterwards you can give. Yes, very good, Shubham. You can give definitely progesterone if it is not cancer. Okay, if it's cancer, then I have to do the surgery. Okay, you can give, if it's only hyperplasia without a TPI, you can give progesterone till the time she reaches menopause. You can even insert Mirena. Anybody, what is this picture now? Terrace view. Chalo, ye kya hai? Already repeat. Is it understood to all of you? So any lady who is perimenopausal, rule out hyperplasia cancer first, and that is by doing histopathology. DNC is the answer. Yeah, same beta. DNC and biopsy both same. Okay, so either I can do DNC or I can also do endometrial biopsy. Okay, endometrial biopsy can also be done. Okay, no, fibroid metastasis nahi hota beta. Okay, chalo, what is this picture? This is the laparoscopy view. We are seeing the uterus. This is the ovary. This is the fallopian tube, and this is the blue color what dye. So this is already told to you, not laparoscopy, tubal ligation. Very good. Not hysteroscopy. This is laparoscopy, chromopertubation. Is it clear? Just don't think and mark मिथिलीन ब्लू देखा तो बी मत मार्क करो. Okay, Laparoscopy chromoperturbation ये है, and the answer is D. Yes, okay. A for apple, please जरा ध्यान से देखो. Yes, not B. Hysteroscopy में you are seeing the inside of the uterus. Hysteroscopy we never use methylene blue. This is the laparoscopy view. You are seeing the pelvis, isn't it? You are seeing the uterus, tube, ovary. Uterus, tube, ovary is only seen with the laparoscope. Yes, this is the laparoscopy chromoperturbation already discussed in the beginning. Will not waste much time. This again I have discussed. This is Myrina. It does not contain estrogen and desogestrel. It contains LNG, total 52 milligram total, and 20 microgram per day. 20 microgram per day is released in the uterine cavity, and therefore A is the answer. Okay, is this understood? With the question is what is the content and what is the total quantity? Yes, तो 20 मिलीग्राम नहीं है, 20 माइक्रोग्राम. इज इट क्लियर? सो आप देखो गूगली डांडी गुल. ओके, यस. सो LNG कंटेन्स 52 मिलीग्राम. ये मिलीग्राम दिया है, 20 माइक्रोग्राम होना. दे आस्क यू हाउ मच इज रिलीज्ड पर डे. ओके, 20 microgram is released per day. Okay, yes, effective for 5 years. Perfectly correct. The most common anomaly in the baby of the diabetic mother. The most common anomaly in the baby of the diabetic mother, ventricular septal defect. Cardiovascular is number 1. And neural tube defect or anencephaly is number 2. Keep in mind. And anybody very good, excellent. Transposition of great vessel भी दिखता है, but sacral agenesis is not the most common. It is the most specific. Okay, it is the most specific. Okay, so don't make a mistake. The very famous MCQ. Yes, okay, and the most common पूछा है, not the most specific. So please don't make a mistake in this, and students will go wrong if they don't read the question correctly. VSD is the most common. Okay, transposition of great vessel is also seen. It's very classical, but more common is VSD. Okay, is this understood to all of you? This is again a revision. In which of the following is an indication for surgical management in ectopic? Okay, so I told you surgical management I will do. That means which of the following? MTX, methotrexate, not possible. Methotrexate is not possible if the sac size is more than 4 centimeter. Is this understood to all of you? Yes. Okay, this we have already discussed. If this is the unruptured ectopic and this, so obviously in both these cases we prefer methotrexate. Okay, so nothing much we already discussed, so we'll go fast in this. Okay, breastfeeding lady who is breastfeeding, the uterus is going to have involution, and that is because abdominal cramps is the uterus getting contractions, means uterus is slightly getting contracted because of oxytocin. Prolactin is for breast milk secretion, but oxytocin is for milk ejection. Okay, so milk ejection happens because of oxytocin, and during the breastfeeding this is called after pains. Okay, this abdominal cramps, this is called as after pains. Okay, after pain. Pritchard regime, the magnesium sulfate level to be achieved. Yes, excellent all. Okay, how much is the magnesium sulfate regime? Very famous, don't make a mistake, and that is 4 to 7 milliequivalents per liter. And as the level, what is the antidote for magnesium sulfate toxicity? Anybody? If the levels keep on increasing, then what is the antidote? and there is loss of knee jerks. Calcium gluconate is the drug of choice for magnesium sulfate toxicity. Okay, yes, all of you correct. So please don't make a mistake. These are must know questions, students. You have to know all these questions before you go for the exam. Again, this is like a revision. Tocolytics are uterine relaxants. Tocolytics are uterine relaxants, and therefore, just a second, 1 second. Yes, all of you. Beta IUCD, okay, because when you want long term IUCD, okay. Yes, ritodrine, nifedipine, atosiban is a oxytocin derivative. It's a oxytocin antagonist, okay. It's not a oxytocin antagonist. Okay, atosiban is a oxytocin antagonist, and yes, magnesium sulfate also tocolytic, but carbetocin I told you is a oxytocin derivative. It is a synthetic oxytocin. It's got oxytocin like action, so it is not a tocolytic agent. Simple MCQ. Positive whiff test already discussed. Positive whiff test is Gardnerella. Gardnerella. Okay, so don't make a mistake in this. Positive if test, we all know fishy odor, Gardnerella infection, trichomoniasis. The drug of choice is metronidazole, and trichomoniasis ka important. You need to treat both the partners. Okay, keep in mind. Okay, greenish. What is the type of discharge in trichomoniasis? Thank you, Jai Vyas. Thank you. Thank you for your love and appreciation. Start following me for for NEET PG preparation. Also, you cleared FMG, great. Go for the app, and you will do very well in the NEET PG. Also, is my guarantee. Okay. Yes. Trichomoniasis, greenish yellow frothy discharge. Okay. ग्रीनिश येलो फ्रॉदी डिस्चार्ज. क्या है ये पिक्चर? कौन सा फ्रूट दिख रहा है? ये क्या है? ओके, सो punctate hemorrhages we are seeing on the cervix. This is a virgin MCQ. Strawberry cervix, strawberry cervix, again seen in trichomoniasis. Trichomoniasis. Okay, is this understood? But a kit and all that, the PSM teacher can discuss the kits better because they hardly use it. Greenish yellow discharge. All are part. Superb MCQ. All are part of AMCEL's criteria except. Okay. So you get grayish white discharge. You get clue cells. They are the vaginal epithelial cells loaded with the organism. You get a positive whiff test, but cooperative for long term. Yes, cooperative. Yes. Okay. Vaginal pH will not be less than 4.5. Yes. Vaginal pH is more than 4.7. So only this sign का गड़बड़ है. ठीक है, sign गड़बड़ कर दिया तो problem हो जाएगा. Okay. So keep this in mind. Is also surely going to be asked to you. I'm still ready for diagnosis of bacterial vaginosis. Okay. Partner treatment not required. Tobacco juice liquor. Anybody? Tobacco juice liquor is seen with what? Tobacco juice liquor is, no, pH is a criteria, but pH is more. Okay. Yes. So you get in postpartum which color you get. Heavy smoker नहीं होता है tobacco to confuse. RH incompatibility golden color liquor. IUFD. IUFD. Yes. Okay. IUFD. Very good. Okay, so please keep in mind, somebody was asking me maximum level of Liker also. 36 weeks is the safest, 1000 ml. Okay, 36 weeks, and then as the patient become post-dated, Liker become less. Me golden color Liker RH incompatibility, very good saffron color in post-datism, and tobacco juice IUFD, and bloodstained liquor is of course abruption. So perfectly correct. IUFD में we get a tobacco juice in IUFD, and maximum liquor is around 36 weeks, 1000 ml. Okay, most common complication in the baby of GDM. So remember, when the mother is having GDM, it's a pediatric MCQ. But remember here उल्टा होता है कि when I clamp the cord, baby का insulin secretion is more side, and therefore there is a risk of hypoglycemia in the baby. Okay, hypoglycemia, yes. So don't make a mistake in this. This is again a very popular MCQ. All of you should get it correct. The last few questions, anybody, what is the clinical diagnosis? I have got a patient who is in labor for 5 hours, strong contractions are there, and the lower pole is empty. Okay, and the fetal head is on right side. Anybody, which condition do I get lower pole empty, and the patient is already 4 centimeter, and on PV examination you feel the shoulders? What is the diagnosis? So the diagnosis is transverse lie. Sir, in transverse lie, we will get lower pole empty, isn't it? Lower pole कुछ भी नहीं है, and when I head is on one side, very good, and when I do a PV, I will feel the baby shoulder. So when the shoulder is felt and lower pole empty, it is a transverse lie, and there is no mechanism of labor. LSCS is the best. Okay, ये outdated yes, C section, ये evisceration, capitation is outdated kachra dustbin. All these destructive operations are never to be done in modern day obstetrics, and even internal podalic version is very dangerous. We will risk of rupture uterus. So you don't do all these things. Please keep in mind, lower pole empty, let the baby be dead still, because there is no mechanism of labor. There is no mechanism of labor in transverse lie, and therefore you have to go and do LSCS. Only destructive surgeries are not to be done, because all this is outdated kachra dustbin. You put the instrument inside the uterus, cut the baby, ये सब नहीं करते हैं. Never to be done. Okay, never to be done in modern day obstetrics. Is this understood to all of you? And the last and the famous, what is this image based MCQ? What is this image based MCQ? Okay, so this is the very famous. Of course, they will give you a clue that this is the USG of the uterus, and multiple fluid filled grapes like vesicle we are seeing. This is the snowstorm appearance. Very good, all of you. And this is a complete vesicular mole, H mole. Okay, complete vesicular mole, and this is the famous snowstorm appearance. Now again, the last part in this, what is the diagnosis? Okay, sir, I have got a patient who comes to us with 2 months amenorrhea and shock. 2 months amenorrhea and shock. UPT positive. Definitive treatment is, anybody, what is the diagnosis? Ruptured ectopic. Okay, so see, all types of MCQs we are discussing. पहला एक stable भी बता दिया, this is ruptured ectopic, and therefore please understand this. Yes. So the definitive management, please understand, immediately open up the patient, stabilize the patient, IV fluids, cross match and surgery. And salpingectomy is the gold standard surgery. Please don't feel sad that you are cutting off patient's tube. You don't do salpingotomy. Methotrexate cannot be given when the patient is in shock. ओके एंड साल्पिंजेक्टमी लैप्रोस्कोपी से बेटर है कि लैप्रोटोमी एट योर लेवल. रिमेंबर, ओके, लैप्रोस्कोपी कर सकते हैं बट व्हेन एट योर लेवल, व्हेन दे टेल यू पेशेंट इज इन शॉक, ऑलवेज बेटर टू गो फॉर लैप्रोटोमी. इट्स ओपन अप द पेशेंट क्विक इन क्विक आउट. साल्पिंगोटोमी नहीं करते हैं. साल्पिंगोटोमी इज कचरा डस्टबिन. ओके, आई विल गिव यू द ऑप्शन ऑफ साल्पिंगोटोमी ओनली. ओके, साल्पिंगोटोमी. Salpingectomy is the gold standard surgery because the tube is torn, that tube is tethered, and therefore I need to get that tube out. Don't feel sad. One tube is enough for population explosion. It means with another tube the patient can conceive. When it's shock, severe shock, laparoscopy is contraindicated. Okay. Postpartum hemorrhage is associated with all of the following except, again, a common sense. Sir, abruption can cause over distended uterus like twins and polyhydramnios and low platelets. Again, IUGR is a small baby. IUGR is a small baby. No, beta. MOPHC Zolapur. Salpingostomy is always done in ruptured ectopic. Always salpingectomy is done. Okay. Zolapur, is it clear? Salpingectomy ही करना है. Either family complete or incomplete. Is it clear? Yes. Macrozomy is a risk factor. Okay. Salpingectomy is always for ruptured ectopic. Salpingotomy, you open up the tube, get the ectopic out, that you can think of in unruptured ectopic. Yes, and only if the family they want to conceive. But ruptured ectopic, you have to go for salpingectomy only. If it's a ruptured ectopic, please remember salpingectomy. Gold standard surgery. Okay, patient is having vesicular mole. What is the treatment for vesicular mole? Okay, sir, vesicular mole, you will not induce the labor. Vesicular mole, whatever may be the weeks of gestation, suction evacuation has to be done because under one shot you can suck out the whole pregnancy. Again, hysterectomy is not an MTP not allowed. It is 20 days. ये नहीं है. MTP laws are not applicable. Okay, so just to fool all of you. Yes, suction evacuation to be done, whatever may be the size. Okay, irrespective of the size of the uterus. Okay, so these are simple and you will not waste much time. Again, very easy. PPH treated with all of the following except मैंने कहा है prostaglandins yes, methergin yes, condom tamponade yes. Last year MCQ shortly coming. Sir, I will do internal iliac artery ligation. पहले the uterine artery ligation, and if not the posterior division. Why? Because uterine artery is a branch of anterior division of anatomy MCQ. Okay. Anatomy MCQ. Uterine artery arises from the anterior division of this. Okay. And what is this instrument? Again, a repetition. ये हमने किया है. So this is a curette. Picture याद रखेंगे. This is a curette which is done for curettage or DNC. If 3 times हुआ है तो क्या होने वाला है? Sir, Asherman syndrome. And Asherman syndrome में patient is not going to get menorrhagia, infertility, all of the above नहीं होता है. Okay, it is Asherman syndrome, infertility and hypomenorrhea. Okay, menses will become scanty, hypomenorrhea. Clap. Okay, so I'm so happy all of you have been doing extremely well and all of you will do this. And the last thing, just a new style of asking the question, just last thing. Okay, that's the last thing, last three questions. Okay, that's the new style of asking the question. Anybody, ye kya hai? Okay, so you have got four statements, and then you have to see which of the following statements are correct. Okay, so directly mat mark kar dena कि prevalence regarding fibroid, all are true. Highest is seen between 35 to 45 years, yes, 30 plus. More common in nulliparous, yes. All fibroids do not require treatment, very correct. All fibroids, if you just see, and display a reversible shrinkage when you give GnRH analogs, yes, that also. So all the statements 1, 2, 3, and 4 all are correct. Is this understood to all of you? Okay, this is just a new way of asking question. Basically fibroids के बारे में, which of the following statements are correct? Sir, all. This is correct, this is correct, this is correct, this is correct. Yes, excellent, all of you. 1, 2, 3, 4 all are correct. GnRH analogs temporarily fibroid को shrink करता है, like other ones. Progesterone also, your anti-progesterone also. And when the action of the drug is over, fibroid will come back to the normal size. Now I want all of you, ये again हमारा पूरा summary and revision है. Endometriosis, I go for laparoscopy. 1B, 1B, 1B. Asherman syndrome, hysteroscopy. 2A, 2A, 2A. टॉर्शन के लिए आई टोल्ड यू कलर डॉपलर 3C, 3C, and fibroid simple ultrasonography 4D. Okay, is this understood to all of you? Very good, Vaibhav, Vashishta, and all of you correct. Okay, Dr. Ruhi, yes. So this is the condition and these are the investigations. So again clap if you feel happy. एक MCQ में 4 सॉल्व किया, तो ऐसे कितने सारे MCQ हमने किए हैं. Okay, so and all of the following are known complications of fibroid and pregnancy except. So when there is a baby and a fibroid, yes sir, there could be abortion, there could be preterm labor, there could be PPH, and what is another complication common? Red degeneration. Red degeneration can also happen in second trimester of pregnancy. Okay, and beta, yes you can. And malformation is the answer. Malformation में malformation नहीं होता है. Very good. Just because a fibroid is there, the baby cannot have malformation like heart, lung, kidney problem. Malpresentation हो सकता है but not malformation. Okay, so this is this. Okay, so I thank all of you and do not please forget to follow on Insta and YouTube, and जो कल हमने post किया है on this channel of mine, there is a 3-hour rapid revision also. All of you have got enough time to see it before your FMG, so please see it and do follow me on Telegram, and all of you can install the OG Guru app and you will get beautiful handwritten notes, and you will get video lectures, and there is the mock test and handwritten notes, and of course doubt solving, and everything is their clinical case based scenario, and this is there. Okay, and all of you can also go for the master class which is available only for 1 month. I'm personally guiding the students how to study, how to prepare. Master class available only at 798, and all of you can go and do this. Okay, so do not forget to please follow on Instagram. Every day I am posting the previous year's question, and every day I am posting the previous year's question, and you will get in touch with me on YouTube channel also and Telegram also. Okay, and best of luck to all of you. And in yesterday's video, I have those ever who want to see the LMP EDD, you can just see the yesterday ka. Okay, okay, 1.5. Okay, thank you Jem, thank you Roy, thank you all of you for your love and appreciation. And just the last 1 minute में आपको मैं बता देता हूँ कि LMP2 EDD, first day last menstrual period, we add 9 months and 7 days. Okay, just 2 minutes of your time, because somebody had 9 months and 7 days added to the first day last menstrual period. So if 13th of July 2021 is the LMP, so 9 months के लिए बेटा the best thing is you can go for 12 minus 3. Okay, 9 is 12 minus 3, all of you know. So this 7 will become 4, 13 will become 20, and do not forget to change the year. This is the EDD. Okay, is this understood to all of you? So this is how you will calculate the LMP. First day last menstrual period, we will add 9 months 7 days. This is for a regular 28-day cycle, which is always they are going to give you. Okay, is this understood to all of you? So the last thing, all of you can type in the chat box. All of you can type in the chat box. If I ask you what will be the LMP if the what will be the EDD if this is the LMP given to you in the question paper. Jate all of you, OG in the 32 day you will add more. Okay, Safat Abdul, then you will add 9 months and 4 days extra. So 9 months 7 days, then you will have to add 11 days. Okay, last में ये anybody? Yes, very good. Last में ये बताते जाइए. This 8 will become 5. 7 plus 7, 14. So 9 months and 7 days. And this is the EDD. Okay, so thank you very much for all your love and appreciation. I wish all of you are going to do fabulously well. Okay, regularly be in touch with me on the phone and WhatsApp and on the Telegram channel and on Insta also, and tell all your friends and colleagues about this app. All of you are going to do very well. We'll be having more sessions. Thank you, Dr. Ashish. Thank you, NLC, for having me here. It was fabulous time for all of you. Wishing all of you best of luck. And I'm going to see you in the upcoming NLC class, also in the online sessions, and also many more YouTube sessions for the NLC channel. So best of luck for all of you. Big thumbs up. Ek baar OG in the chat box. And thank you all for coming. Best of luck. And all of you will do very well is my guarantee. And all of you will pass the FMG exam, and see you also for the NEET PG preparation. Thank you very much.